You are watching the broadcast of the El Paso County Commissioners Court meetings. Commissioners Court meetings are held every Monday at 9:30 a.m. on the third floor of the El Paso County Courthouse, located at 500 East San Antonio in downtown El Paso. These meetings are open to the public. The meeting will start momentarily.
Okay, we are up.
Good morning. Today is Monday, April 13, 2020. Commissioners Court is meeting in regular open session. Would you please rise and join us for the Pledge of Allegiance, followed by an invocation by Pam Perot.
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with justice.
Okay, Ms. Brony.
Good morning, Judge, Commissioners, County Leaders, and staff.
Good morning.
Almighty
Good morning.
God, we humble ourselves before you today, acknowledging that El Paso County needs you. We who are your people in El Paso seek you for direction and guidance for our county and city leaders as they navigate this difficult coronavirus plague. We pray that our city and county governments will continue to unite and speak with one voice. We are grateful for the commitment each one has made to see that we are safe. Lord, we recognize that even now our leaders are already grappling with how businesses and government will reopen when the time is right. Grant them wisdom for this process. We pray for those who are on the medical front lines of this battle, those who take a risk every day to go to work to serve their community. We ask you to meet their personal needs as well as the needs of their families as they are caring for us. Help our leaders know how to give hope and encouragement to the people of El Paso. Your word says those who hope in the Lord will renew their strength. Renew us, Lord. Strengthen us. May the God of hope fill us with all joy and peace as we trust in him, so that we may overflow with hope by the power of the Holy Spirit. We stand on your word in Jeremiah 29:11. For I know the plans I have for you, El Paso, plans of peace and not of evil, to give us a future and a hope. In the powerful name of your Son, Jesus, amen, and so be it.
Amen.
Thank you, Mrs. Ferroni. Really appreciate you taking the time and being with us, and always your passion and effort to guide us in the right direction. So I thank you everyone for joining us today at Commissioners Court. It's really our post-Easter, and I've said it's probably one of the most challenging situations of a community that is known for getting together and enjoying their families. So I know it's a very difficult time for everyone to stay at home and to be conscientious of what we're trying to accomplish. It's not an easy. We've been asked to be united as a community. Now we're being asked to be united more as family members, and to be able to move forward with the orders and what we have to do. And I think El Paso is going to come out in a good sense, in a good way. We'll come out from this COVID-19 in a way that it could be recognized, and we will be a role model. I insist. I have all the confidence of the community that we have because of our past. So I thank you for that opportunity to be part of such a difficult situation for everyone concerned in this region. I'll wait for some of my comments on what's been taking place and some of the information that I have based on the relationships with the public health officials, with the mayor and other and other officials in our fight for this disease or this virus. And so I'll wait until we get to that part in our Commissioner's Court. So thank you very much.
Item number 4 is the consent agenda composed of items 4A through 4W. For item 4L, we asked for this item to be postponed 1 week. Item 4L reads, approve and authorize the county judge to sign the laboratory service agreement with Invitae Corporation for genetic testing for the Office of the Medical Examiner. The agreement automatically renews until terminated by either party within a 60-day written notice. The genetic testing is free of charge with additional panels available for an institutional price of $300. Funds are available in General Fund, Medical Examiner Contract Services General, contract number 2020-0224. Are there any other items that members of the court or public would like to pull for individual discussion?
Commissioners?
Yes, Commissioner Roberts, item V, 4V.
Item
Item
4B
K,
for
please.
Commissioner Robinson. I'm sorry, which other item?
Commissioner Perez?
Item K.
K.
Okay, for Commissioner Perez. Any other items?
Okay. Move to approve the remainder.
Second.
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries. Item 5A, resolutions. Approve and adopt a resolution recognizing April 2020 as Census Month in El Paso County, Texas.
Commissioner Stout?
Good morning, Judge and Commissioners. I appreciate the opportunity to read this resolution. I think as much as we possibly can, we need to remind folks that the census is still upon us, and folks can still go ahead and fill out the questionnaire online. El Paso County is just above 40% when it comes to the amount of folks that have filled it out. So we've got a long way to go, and so we wanted to bring this resolution on behalf of the Census Bureau, just to remind folks and ask them to fill out the census questionnaire. It's really so important when it comes to the amount of money that this community is going to receive going into the future when it comes to things like transportation, healthcare, education, food, nutrition programs, and other really important projects. And programs. So I'm going to go ahead and read the resolution. Thank you very much. Whereas the United States Constitution mandates that a census of all the nation's population, regardless of citizenship status, be conducted every 10 years, and that the 2020 census is based on residency in the country on April 1st, 2020. And whereas it is vital that all households in El Paso County, Texas, complete and submit a census form, as every resident who calls our community home counts and deserves to be counted. And whereas the census will help determine how the federal government distributes $400 billion in funding for community services such as housing, transportation, healthcare, economic development, and other vital needs. And whereas accurate census data helps ensure that fair congressional, state legislative, county, and city electoral districts are drawn. And whereas it is essential that accurate data be collected from groups of people who are historically difficult to count, including young children, low-income individuals, military personnel, households whose primary language is not English, ethnic and racial minorities, and rural residents. And whereas census information is confidential and protected by law, and whereas planning, outreach, local government involvement, and community education are necessary to ensure that the 2020 census count is as accurate as possible. And whereas the County of El Paso has led the community-wide effort of the Paso del Norte Complete Count Committee that was established in 2018 by the county and the city by contributing $370,500 towards the effort. And whereas El Paso del Norte Complete Count Committee strives to encourage every resident of our beautiful and resilient community to complete the 2020 Census questionnaire online at my2020census.gov, by telephone at 844-330-2020, or by mail. Now therefore be it resolved by the Paso County Judge and Commissioners Court that April 2020 be recognized as Census Month in El Paso County, Texas.
Second.
I'm sorry, second.
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries.
Thank you all.
Commissioner, do we have any representative,
Yes.
Ms. Lopez, or anybody from
Please.
the census today?
This is Miguel. She's on the phone, on the line.
Thank you.
Good morning, Judge, Commissioners, county staff, and leaders. I very much appreciate your support and the passage of this resolution. As you all know, the census plays a very important role in our county, and it informs county responses to the evolving needs of our residents. As our county grows, getting the count right will help ensure that our families and neighbors receive the services they need and an accurate representation in the U.S. House of Representatives. We know that our county has changed very much in the past decade, and the census allows us to make an impact not only for next year, but for the next 10 years. So by completing this year's survey, we can ensure that the programs that our community needs receive adequate funding for schools, hospitals, senior centers, and other public works, as Commissioner Stout mentioned. And this is very important, especially during these hard times that our community is living. So thank you for your continued commitment and for urging all El Pasoans to fulfill their civic duty by participating in the 2020 census online, by phone, or by mail. So thank you for your continued commitment, and looking forward to keep working with the county commissioners, county staff, and department heads to make sure that we have a complete and accurate count, and that the El Paso County community is counted in the 2020 census. Thank you very much.
Paulina, I want to thank you for incredible hard work and the passion that you have displayed from day one. And also want to thank you for getting the public to understand, and our community to understand that, I've talked a lot about the fact that how are we going to come out when this is all said and done? And what we don't want is to have to go back on things that were unnecessary. Filling out the census and being successful can be independent of what's happening to us as a community today. And so I keep saying, keep the end in mind. When we come out of this, there's certain things that shouldn't be left behind. Where we were at the point in time when we went into this crisis should be the least of the benchmarks. And then we need to go forward. And one of the things that we talked about that was very, very important for El Paso was the accurate census count, so that we could get the type of funding that is required in a community that has so many unfunded mandates. And the only way we offset those mandates is by having proper funding, or at least our lion's share of any funding that comes into El Paso. And the census is a huge key to this funding. And so I urge the community and everyone that is part of this broadcast to get that word out. We do not want to come out and know that this is something that we can't recuperate, because the census moves forward and numbers are counted, and we don't want to be undercounted. So, I really appreciate everything you've done in representing El Paso, and I thank you and your team for this effort. And I know the commissioners and Commissioner Stout, has taken the lead on this, but Commissioners Court in its totality are very supportive. So whatever we could do to make this happen and allow us to come out of this crisis without one more collateral impact on our community.
Thank you,
Judge,
Judge.
I just wanted to also thank Paulina and the Census Bureau and all of her colleagues at the Bureau. I'd also like to thank the continued efforts that the Complete Count Committee has undertaken. You know, it's been a lot more difficult for us in the wake of the COVID-19 pandemic and trying to figure out strategies and understand the best ways possible that we can reach out to folks. And so I appreciate the opportunity to be able to have a resolution today. I also wanted to mention that the NALEO Education Fund, along with a number of other organizations like Mi Familia Vota, the Mexican American Legal Defense Fund, Legal Defense and Educational Fund, Voto Latino, Unidos US, the Labor Council for Latin American Advancement, the League of United Latin American Citizens for Immigration Reform Movement, and United We Dream, as well as NBC Universal Telemundo. They are sponsoring a campaign this week, the week of April 13th to 18th, where they're encouraging folks to join and reaching out to Latino communities. And of course, we all know that the vast majority of this community is Hispanic. You know, Latinos, as we alluded to before, are among the hardest to count communities in the country. Of the 1 million young children who were missed in the 2010 census, 40% of them were Latino children under 5. Additionally, you know, Latinos are, of course, diverse in ethnic and racial backgrounds, immigration status, languages that they speak, and the communities in which they live. And they represent the second largest population group in the country. And according to the U.S. Census Bureau, it is estimated that Latinos could make up more than 21% of the total U.S. population by 2030, so in just 10 years from now. And so this is why it's critical that the growing Latino community receive its fair share of resources, which of course are predicated on an accurate count of our population. Despite the incredible potential of this community, ensuring a fair and accurate count remains an uphill battle, as we've discussed, especially in the face of what's been going on with the coronavirus. However, there are so many organizations like NALEO and our own CCC that are dedicated to trying to make sure that all Hispanic folks, all Latinos, are counted as part of our commitment, and making sure that we have a complete count. So just wanted to mention that as well. We'll be working, our CCC will be working with these other organizations, especially because our community is so heavily Latino or Hispanic. Thank you.
Thank you, Commissioner. Appreciate those words.
Thank you all.
Jessica?
Thank you, Judge. Item 5B, approve and adopt a resolution recognizing the week of April 12, 2020 through April 18, 2020 as Public Safety Telecommunicators Week in El Paso County, Texas.
This is Commissioner Robinson. I had the privilege to read this resolution. Whereas the men and women serving the public safety, telecommunications, 911 operators, dispatchers, and other communication specialists who are dedicated to saving lives, and whereas these professionals, the unseen first responders, provide critical assistance to Texans in times of great need, and their specialized skills and calm presence are invaluable to the Lone Star State. And whereas the Communication Commission, the State of Emergency Communication, working with the local and state governments, ensure, and whereas the highlight of the invaluable role of the public safety communication communicators and commissioners annually designate a week in April for an awareness campaign. Excuse me. And where all residents of El Paso are encouraged to extend their appreciation to the public safety communicators. Their diligence efforts ensure the help is on the way when we are in need the most. Now, therefore, be resolved by the county judge and the commissioners court that the week of April 12th to the 18th, 2020, be recognized as Public Safety Telecommunications Week. Signed by the commissioners on this day, the 13th of April, 2020.
Second.
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye. Commissioner
Motion
Robinson, do you
carries.
want to say some additional words, please?
Yeah, oh, yes, definitely. It's very vital that we recognize these individuals because they are unseen. They're behind the scenes. You talk to them on the telephone when you have an emergency, but the patience and intelligence that and assistance that they provide is very vital. Sometimes we call, and I've had the occasion, I'll say the privilege, the occasion to have that. Well, I didn't call them myself, but using their services. But when they talk to you on the phone, they're very patient because when a person is in a stressful situation, maybe whether it be a heart attack or whatever their situation is that causes an emergency, someone invading their home, and they need the police to come and provide assistance. These are critical. These individuals are critical link to help us on the way. So I recognize that someone from the sheriff's department should be there or on the line. I'm not sure, but we say kudos to all the public safety providers in our community.
Jessica, do we have, or Miguel, do we have anybody on the line on this particular resolution?
No, Judge, not for this item.
Okay. Commissioner Leon, would you like to add?
Thank you, Commissioner Robinson, for bringing that up. And I've got to say that we said this before in many of our other meetings, that really those communicators are really our first responders. And they are really the unseen heroes. They're very much heard at times, but they make a big difference at the outcome of many of the calls. So again, thank you. And as Commissioner Robinson mentioned, they are the first responders on every one of those calls, and they make a huge difference in how it's handled. Thank you.
Thank you, Commissioner Leon. I've never been, I had a sense of appreciation, but in the last 8 months, as we've gone through crisis and the refugees and, the August 3rd and now the situation, their value to our community is immense, but I think we're all saying the same thing, and that is I'm not sure that they do get the recognition that they deserve, and thank you for that perspective of they are our first responders, and I think we forget that. We think they're like sort of connecting us to the first responders when they're the ones that start the ball rolling in the right direction. So, Commissioner Robinson, you were going to comment?
Yeah, well, one last comment is that that we don't realize that the job that these individuals provide is a very stressful job, and it is a very high turnover rate in their job. But because of the stress, some people may think well, it's an easy job. Listen to someone and answer a phone call and call for the police or fire department to send them out to your residence or whatever. But the stress that these individuals endure is immense. So kudos to all those that work in that environment.
Thank you, Commissioner Robinson. Jessica?
Item 5C, approve and adopt a resolution recognizing April 12, 2020 through April 19, 2020 as Animal Care and Control Appreciation Week in El Paso County, Texas.
Well, once again, Commissioner Robinson, I have the privilege to read this resolution again. Whereas the National Animal Care and Control Association, NACA, has designated the second week in April of each year as the Animal Control Officer Appreciation Week. Whereas the El Paso County Sheriff's Office is committed to setting the standard of professionalism in the animal welfare and public safety throughout the training, networking, and advocacy. And whereas the animal care and control professionals dedicate their lives to the health and the safety of at-risk, helpless animals, and whereas the animal care and control professionals work to rescue and protect animals from injury, disease, abuse, and whereas federal, state, and local government officials throughout the nation take this time of the year to recognize, thank, and commend all animal care and control professionals for the dedicated services they provide. And whereas all residents of El Paso County recognize and commend animal care and control professionals for the many dedicated long hours of service they perform and the fulfilling the commitment of providing the highest and the most efficient level of customer service. And now, therefore, be resolved by the El Paso County Judge and Commissioners Court that everybody recognize April 12th through the 19th as Animal Care and Control Appreciation Week.
Second.
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries.
Miguel, anybody on the call on this resolution?
No, Judge, not on this one.
Judge?
Betsy Keller, would you mind talking a little bit about, our new director and
Yes.
what we're doing in the county to that relates to this resolution?
Yes, sir. First of all, I did just want to mention we do have our new animal welfare director who started last Monday, Lorelei Combs. She's actually out at the station this morning meeting with the team. And I want to specifically call out our team members, Christina Trio, Lorenzo Juarez, Crystal Reyes, Hermine Reese, Renee Herrera, Crystal Hernandez, William Palmer, and Anthony Ramirez, who are our animal welfare officers who are doing a really important job during this time. They're continuing to serve the community. They always do important work, but especially during these times, they're out there continuing to serve the community, looking out for the welfare of our entire community, including our animals. And so just want to specifically recognize them and Lorelei, who's already looking at ways we can improve the way we serve the community in this area and look out for the welfare of animals. The team is also realizing and has expressed through one of their leaders how thankful they are that the county is dedicating the resources it is and the attention it is to this important issue. So just wanted to specifically recognize them and welcome Lorelei to our team. We're really excited to have her on board. She has a wealth of experience in animal welfare. She's worked both in Texas and Austin and in Broward County, Florida, where she has led the animal welfare operations there. And we're just really pleased that she's joined our team and the wealth of knowledge she's going to bring to help us be even better in these areas.
Well, we welcome Lorelei and very, very fortunate to have the caliber of person that and what she brings to the table. We were always very, very concerned, obviously, about animal welfare, and I think we're now stepping it up. We're trying to match as much as we can. Celeste Varela in my office is a liaison with the city. She's on the board with the city, and so that connection of having a county member, she is a county resident, first one that I know of that is on the board, and so really that connection and that connectivity, as we have seen, when we both work together and go in the right direction, we can be extremely powerful and in reaching our objectives. So Betsy, thank you so much for guiding the process and for having Laureline on board, and very glad to move forward. Commissioner Robinson, any additional comments?
Well, once again, we have public servants who provide a great service to our community. And the thing is that one is they go out and make sure the animals are treated properly, but more so as far as the education to the public, as far as what the individual animals owners, what their responsibilities are. You know, it's not when they get us get us a puppy. You know, they this is a nice little puppy, but realizing that puppy is going to grow and become a big dog in most cases. But the care of those animals, when you take on the responsibility of owning one, you have a responsibility to make sure they're properly cared for. So we have those specialists to make sure that they understand what the rules are and abide by them.
Well, thank you for your words, and thank you for bringing forth this resolution. Very much needed at this time. I've noticed a lot of dogs are some people do gain, and I've never seen as many dogs walking out in their neighborhoods with their owners, and I think that's the type of relationship that we should have. So the timing is excellent. Commissioner Robbins, thank you for that resolution.
Well, thank you for the privilege.
Jessica?
Item number 6, public comments. At this time, we do not have anybody signed up to speak for a public comment. We'll take no action for item number 6. Item number 7, county administration. Discuss and take appropriate action regarding El Paso County's preparation and response for COVID-19. And just for information, we do have somebody signed up to speak for this item.
Betsy, you want to?
Yes, sir.
Good
afternoon, or good morning, Judge, Commissioners. Miguel, I believe you're going to pull up the slides for this item. Today, what we'd like to do is we'd like to start off, and one of the areas, Judge, I know you have some updates after we hear from Public Health and OEM, but we also, if you can go to the next slide, Miguel, we also have members of the court who have been taking the lead on some particular areas. And we wanted to each week have this slide where if any member of the court would like to share an update with the group, they would be available to as well. These are some of the areas that have been identified for members of the court that they're particularly involved with. And then, of course, Judge, the areas that you're working on, and also I know you're working on some economic recovery efforts as well. So I didn't know if at this point the court would like to give their updates first, or would you like to hear the other updates?
Well, let me just give a broad introduction, and then we could start. You know, it was obvious that there's so much passion in each one of the commissioners, and so I had a discussion with Betsy to say, you know, how can we align and we don't try to duplicate, but that we can use all our synergism to go forward. And I know there's so much, so much passion in each one of the commissioners in different areas, more so than others, but obviously in everything else. And so I just felt strongly that Betsy could guide us and get information from me to all of you and to your staff, and then vice versa, you know, that you guys could get information to me as I have to present, or I'm being asked as the lead in the order. So I'm asked a lot of questions. And it is to my favor that I do present the right information. Nothing worse than somebody in a political office having a misconception or not being fully understanding. And all of you have some incredible staff members. So the idea was, how do we gain this traction and everyone's sort of moving in the right direction. So I'm hoping this would help. I've asked Nicole Reese to sort of continue to be the liaison, not only with your staff, but also with Betsy and with OEM. She's done a tremendous job of really close to the entire process and full communication with Jorge Rodriguez and Chief Rodriguez. And so this is really the idea of putting together the energy moving forward. And I think, as I've said, every commissioner there is really supporting the process and have decided where's one area that they can really focus on. And then they have staff members that have incredible talents that we could utilize. It wasn't, the idea was not to leave anybody behind, but at first it was a little overwhelming trying to guide the orders. And so I'll go a little bit into that. Last week, we were pretty adamant about, getting some more information into the orders, becoming a little bit more strict in working with the city and aligning ourselves. The governor seems to be going in a different direction where he's, sort of lessening some of the restrictions where that happened in our religious faiths, where there was an opportunity to go back a little bit and celebrate the mass or be able to have the congregations show up. We decided, and the leaders decided, that they wanted to be where they were, and I thank them dearly, because if you're in the middle of this situation, you realize that things aren't getting that much better, and that we're beginning to get even more and more cases, and we've had our 2 deaths this past weekend. So we can't take any chance of sending a message to our community that we're okay now. It's quite the opposite. We really need to lessen the social gatherings. The grocery store is still becoming a problem. I've advocated for masks for the employees. It's easier to enforce. I asked Melissa Carrillo to give me some feedback on, what's the HR? What are things that an employer can and cannot do? And we don't find anything other than, hey, if you want to show responsibility, have your employees wear masks. It's a lot easier for somebody to say, so-and-so's not wearing a mask, go to the manager and they can address that. Getting the public to do that becomes quite an ordeal. And one of the things that we have found through this whole situation is, 1, keep the message strong. 2, don't back off your message. And 3, make sure that we can enforce it. And if you can't enforce it, it becomes a problem, because then people feel that they should enforce it if someone else doesn't. And we don't want to get our community into that role of calling out people in a grocery store that could create issues. So things that can be enforced, I think, very quickly are having employers require masks for all of their employees. I take my time, I go out, I drive, I want to see the impact of the order. And I don't see that the businesses, I've gone to certain carryouts and they come out without mask, and you look in, they have blocked off, but you look in and someone's not wearing a mask. And so, we call on the manager, try to get that taken care of. But I think if the businesses understand the importance, their role is probably bigger than anybody else's, because we're allowing that to be an essential business. And we have to show the rest of the community why that is so. But if that essential business is creating the spread of COVID-19, then it does not make sense. And so that's where we are now. We've looked at, I've had an opportunity, Commissioner Leon with enforcement background, and, asking him to sort of stay in touch with sheriffs, constables, and so forth, to see what are they dealing with and what are they going through. The biggest challenge we had was Easter, like I said earlier, and now we're giving the community an opportunity to respond. And given the response of the community, we'll be able to understand how we're going to go forth. I've been working with a legal team to address ahead of time. We've been very proactive. We have one of the Joanne Bernal and Christina and Erica and everybody else have done an incredible job of keeping me aligned properly and ahead of the curve of trying to find out For example, if we feel that certain things or certain activities should continue to be closed down and the governor goes in a different direction, what do we need to do to be able to say in our community, given our uniqueness, given our demographics, they're very different from the rest of the state. What legal ground do we have to make sure that our community is protected? And obviously, one of the things that we have on our favor is the strength of Commissioners Court and each one of us going in the right direction. I feel we're pretty aligned in understanding strict is better than pulling back, especially we're not seeing the numbers go down, or at least we're not seeing the flattening of the curve. So that's pretty much at this time what we're going to be involved in. I've got a telecast on Wednesday. We're going to take a regional approach. I've asked the mayor of Juarez, the mayor of El Paso and Las Cruces to participate on a regional effort and have discussions with our community, and then us be able to bring some things forth, like is what are some of the things that we'll need to do if they're not adhered to. So that's going to be an important step. Then finally, Nicole has coordinated Dr. Orocoranza and Chief Rodriguez to be able to come on every Commissioner's Court, provide the feedback for us, and then try to answer as many questions. Several of the commissioners have had questions that we're hoping that they'll be covered under their presentation. What I would like to recommend, and that's at the favor of the rest of the commissioners, is that they try to accommodate as much as possible on the questions that you've asked them beforehand, because I don't want them to have to try to answer things that they haven't adequately researched. Some of your questions are pretty unique and creative, and so it requires time for them to do that. So my hope and what I'd like to see is both Chief and Dr. Orocaranza to try to cover the questions as much as possible, and then if there's anything that's not going to go into a very long, it's pretty difficult to have a long Commissioner's Court and have them to respond or go into more time than they should. So that would be the process. See if they can answer the majority of the questions. If it's something that needs enhancement, that would be great, but I would appreciate if there's a question that requires more investigation, that you submit it to Nicole Ruiz, and then she would present those questions to both gentlemen, so we can have a very productive Commissioner's Court. So at this point, I give it back to you, Betsy, and I don't know if you want to comment, and then I believe, I don't know who's online right now, Miguel, but whoever is on first to start their presentation.
Judge, do you want to go to the health office, Dr. Orocoranza and Chief Rodriguez, before we go to the rest of the commissioners?
Yeah, I think that'll help, because then they might answer some of the questions or provide some of what's going on, and allow them to sort of understand what they'd like to see. Maybe they can answer the majority of the questions at this point. So yeah, I believe it's Dr. Orocaranza will be going on first.
Yeah. Okay, then Miguel, will you turn it over? I believe Dr. Orocaranza is on here. We just need to unmute him.
Yes, he needs to unmute himself and start his presentation.
Okay, great.
Hello, doctor.
Can you hear me now?
Yes, sir.
Yes, we can.
And we see you, yes.
Yes, sir.
Excellent.
Welcome.
Good morning, County Judge and Commissioners. I'm Dr. Hector Carranza from the Department of Public Health. Just to give them a quick update on how we're doing on the COVID-19 pandemic here in El Paso City and County. As you all know, the coronavirus pandemic arrived to El Paso approximately March 13, when we had our first case identified. We, at that time, had been doing some targeted testing, which included at-risk populations, to try to identify how the virus was introduced to our community. We initially saw that the virus started in our community based on travel, and those people that were traveling to high-risk areas or hotspots, as we know them, were the ones who came back to El Paso and were the ones testing positive. After that, we learned that we had community spread of the virus, and a lot of the interventions that we did, called non-pharmacological interventions, that we started doing was rapidly closing schools. We did that through orders, directives, and guidances that we had to provide. And then we come with closing restaurants and bars. Then Governor Abbott came and suggested and recommended closing gyms, beauty salons, and with the help of the county and the city, we created the first stay-at-home work safe order. That was a very comprehensive order that I applaud to everybody involved, because it took a lot of dedication, a lot of coordination, but it was aimed at protecting our community, and that's the best way to protect our community, making sure that everybody stays at home and having only essential businesses working. After that, we came back and amended our first order, where we made it a lot stricter, and the list of essential businesses were smaller. At the same time, we closed parks and other recreational areas that were used by people for gathering, even though in the first order we told them to stay at home, to avoid mass gatherings, because that was going to be the way that the virus was going to spread a lot faster. We know that scientifically it's been proven that social distancing, proper hygiene like washing hands, not touching your face, and staying at home is going to be the best way to prevent the rapid spread of the virus throughout our community. The objective of doing this is not to overwhelm our healthcare system, and we need to protect those that are at risk from developing severe complications. Now, to all the public in the county and the city, we are recommended that everybody wears masks. As Judge Samaniego said, that he goes to some public places and some people are still not wearing their masks, but we recommended that all of us wear masks when we're in public, and that's a way that it's also going to prevent the spread of the virus, because we know that there's some people that are going to be spreading the virus without having any symptoms. When somebody is symptomatic in the household, we have been telling the people to stay home, tell everybody in the household to stay home, because at one point or another, they're going to become symptomatic as well, and we can consider everybody is infected. If we do that, then we will continue to slow down the progression and the spread of the virus. So if we know friends, other family members, just keep recommending that, wear their masks, stay at home, don't go to work or outside when you're having symptoms. The current case count up to yesterday, it was at 292, of which 147 were females, 145 are males. We have 57 people hospitalized. Out of those, 23 are in the ICU. Our healthcare workers are working tirelessly to heal all these patients that needed hospital care. And I want to recognize the hard work that they all have been doing in helping us heal our loved ones. Unfortunately, we had 2 deaths in the city and the county, and we're continuously monitoring the situation in the hospitals and in the ICU to be able to see any possible trends, whether the virus is presenting with more severity among all those high-risk groups, or even in those group of people that are not typically considered high risk. As we know, there is no proper treatment for the virus, and the people that develop a mild disease, they recover with no other intervention, just staying home and just resting, drinking plenty of liquids and fluids. But for those that are in the hospital or present with moderate to severe disease, there's different treatment modalities that our healthcare providers are using. One of them is an antiviral called remdesivir. Another one is hydroxychloroquine and also convalescent serum. There are some other treatment modalities that might be used, but it's on a case-by-case basis that they're using these treatment modalities so far. So we will continue with our current orders and definitely we continue providing the same message to the population. The more we comply with the orders, the more we comply with all the guidances that we have put out, the better we're going to be in our city. As Judge Samaniego said, we're hoping that we can be a model city in the state of Texas in the way that we respond to this pandemic and the way that our community responds to these orders and guidances. And hopefully in a nearby future, we can see all this behind us. And again, I appreciate all the support and all the help that the county has provided.
Doctor, I want to I hope people realize the engagement of Dr. Carranza has just been amazing. His connectivity to us, his response to us has been just extremely impressive. You know, I could call at any time and either he's takes my call or gets back to me immediately. And it's been what a resource. Like I said, I get a lot of questions and I never try to answer anything I don't know, at least profoundly understand. And he has been invaluable. And just the number of hours and weekends and the time that he's spent in trying to do the best in flattening the curve is very impressive. So, Doctor, I really thank you for your work, your dedication, and also for that connectivity that you've had with the county. Thank you very much.
Thank you, Judge.
Betsy?
Any questions?
Yes,
Commissioner Perez?
thank you, Doctor, for the information. I don't know if he's still on the line. In looking at some articles and looking at what's happening in other communities, one issue has been congregate living facilities. The lack of reporting that comes from those facilities statewide has been very difficult to ascertain. The number of nursing homes or senior living assisted centers. Trying to get information from that. My first question is have we been able to ascertain information from congregate living facilities here in El Paso? And my second question is regarding the level of testing taking place here. The daily reports that we receive the number of tests that are administered by the Department of Health, but I hear it's very difficult to ascertain the number of tests that are being conducted in private labs. And I think it's important for us to the very best of our ability to try to get that number, to analyze the number of tests that are being conducted in our community relative to other places. I hear that there's some cities in New Mexico where they've done tens of thousands of tests, and obviously they're going to have higher numbers. But in order to get an accurate assessment of those who may have the virus, I think that hasn't been made clear, at least the level of testing that's taking place. Just wondering if you could answer those two questions.
Yes, sir. And going to the first question, as far as those congregate living facilities, we have been getting reports from them, and there's different ways that we get those reports. One, from the actual place, the nursing home, assisted living facility, but also from their medical providers, because the Department of Health collects information within their reportable condition list, where all the providers are required to report all those conditions. When any of the residents or staff members go receive medical care and they're test positive for COVID-19, They are reporting those to us. And even though we might have duplicate reports, I'd rather have more reports than none at all. We are working to provide a guidance document for all those facilities where we have a very organized way that we need to protect all those that are residing in those facilities, because those people are the ones considered to have most of the comorbidities, and they're considered high risk of complications if they get infected with COVID-19. So we will provide that document for the public as soon as we finalize it. And definitely we have looked at that angle. And as we have looked at many other angles that we need to provide guidance and recommendations around the city and the county. For the second part of the question, as far as the testing, yes, we have been contacting all the private laboratories to get a number of those tests that we have been performing around the city, because the drive-through testing is one of the collection facilities for samples, but some private physicians also collect some samples from their patients, as well as the hospital have been doing the testing in those that are admitted to the hospital, especially paying particular attention to those critically ill. We have some preliminary numbers, and very happy to see that we have been moving forward with the testing, although there's a lot of work to be done in the testing arena, but we will continue doing this. There is technical difficulties that we need to address as far as the sample testing, because many times the swabs that we need to collect, the samples are not in big supply, and it's not a problem unique to our city. It's everywhere in the country that we're having this problem. But when we collect samples, we need to make sure that we're going to be protecting those taking the samples, because it's not easy. They need to be in full PPEs. We need to establish the whole process where we're protecting the patient and the one taking the sample. So with all that, Chief Rodriguez can explain a little bit more, because they've been instrumental in developing all the proper procedures to protect both patient and the personnel that we have at the testing site.
Judge, I have a question.
Thank you. Commissioner Robinson.
Doctor, one group of people that we have not talked about that are very critical to the mission of providing service to our community is our sanitation workers. They are exposed to all the elements from, we talk about protecting, the patient and protecting the healthcare workers, but all of the waste that comes from those facilities and as well as our homes, we got people, the sanitation workers, they're exposed to it directly every day. In other words, they had to go directly into emptying the waste into the trucks, picking it up, wasting. So, have we looked at that group of people as well, as far as looking at additional safety measures for those individuals? If we have not, I very strongly suggest that we do, because those individuals are directly exposed to that environment on a daily basis.
Thank you, Commissioner. Doctor?
Yes, thank you, Commissioner, and thank you for looking after all these worker people that can be exposed to potentially to the virus. And Chief Rodriguez can give you a little bit more information and details about how we're protecting those that work in the sanitation department.
Okay.
Thank you. Just an additional comment is one of, as I've talked about, you sort of move towards more restriction. And one of the areas that we've looked at very closely is the adult daycares. And, Bien Vivir, who's one of the leading daycare providers, took a really quick response, and they have converted everything to home care. And so all their personnel is now doing home care. So we thought, why don't we look at that being across the board? and had lots of discussion with Dr. Carranza. And it's not that easy. One of them, it takes every person in an adult care facility is able to obtain home care, but the transition is not easy. And so we were very concerned about, let's say, a first responder that has someone that they need to be taken care of, and they're not able to do that, and they might have to take care of them at home, and then that deprives our community of a first responder to be out in our community. And so we're trying to look at that, how critical is it for us to move forward with the remaining daycare facilities? And then secondly, are we able to transition them to home care without, in a transparent manner? So that's one of those items that's out there that we're looking at. And like Dr. Ocaranza said, they're the most vulnerable. So we want to protect them. So we're looking at ways to be able to do that. So now I think we have Chief Rodriguez, if you don't mind starting your presentation.
Chief, you are on. I think you might have to unmute yourself.
You just need to do the camera.
Chief Rodriguez?
I'm here.
Go ahead, Chief.
So,
here you are.
Good morning, Judge and Commissioners. Thank you for having us this morning. I'm going to just go through some really quick stats. So as you all know, we are at 292 positives. We had 2 fatalities last week. Unfortunately, we have 57 that are currently hospitalized. 20 of those are in ICU. 145 are male, 147 are female. Department of Public Health tests are at this point at 869, and this is for, again, our local lab. And this will tie into some of the concerns that we had. So in regard to some of those congregate settings, we have our education task force. We are targeting those specifically this week to ensure that they're following the proper orders that have been laid out by the Commissioner's Court and City Council and our local health authority. So we are making sure that they're not having visitors as prescribed, and that they're following the orders as they've been provided. The education task force to date has visited over 4,400 different sites. They've distributed almost 89,000 flyers to the community, and they've reached approximately 28,000 El Pasoans through their outreach efforts. Also, our COVID compliance task force, which is made up of El Paso Fire Department fire prevention personnel, Department of Public Health, and city codes. Through our intake process, we've had over 3,800 non-compliance complaints since March the 24th. We've had over 20,975 site visits, 641 warnings, 12 citations, and 364 follow-ups. So the compliance, as you can see, has been very, very aggressive over the last several weeks as the orders have come. They were out this weekend, making sure that the parks weren't being utilized by families for their well-being and safety. Hospital information, we're at 2,205 beds. Those are available beds, licensed beds within the community. 75 ICU beds as of reported yesterday, and 307 ventilators. Our drive-through site, we've done well over 1,900 specimens collected in the last 3 weeks. We were able to receive an extension through the Department of Public Health over till the end of May, which was great news. Through FEMA, they sent us federal assets back in March 23rd, and they've given us an extension till May 30th.
That particular site allows us to sample up to 250, to get over 250 samples a day. And for the drive-through, it's very labor intensive. We have about 25 to 45 operators out there Monday through Saturday. Our breakdown of the various operational missions that we have between our integrated response between Office of Emergency Management and Department of Public Health covers several areas. So our EOC has been activated since March the 13th. We went up to level 1 when we had community spread and it was determined. So we are fully staffed. About 50% of our EOC staff is gone virtual. Our partners are using web EOC to provide us updates and information on a daily basis. The core people that we have here on site is to ensure that we're having that coordinated effort across the response. So some of the EOC missions, well, let me begin first with the Department of Public Health core missions. So in the attempt to do the best we can to contain this pandemic, the Department of Public Health is focused on lab testing, their epidemiology investigation and monitoring, the medical orders that Dr. O just discussed earlier, the community-wide orders and those sector-specific orders, and their education information to the community through the Education Task Force. On the EOC side of it, of course, the drive-through specimen collection site, again, in support of the Department of Public Health to expand their testing capabilities. That one's been online since March 23rd. The medical order compliance, we're helping also to support them with that task force. There's also an isolation and quarantine support that we're providing. We understand that there might be individuals that may be COVID positive or may have potentially been exposed awaiting a result from a test. So we have a isolation and quarantine plan that we utilize hotels to put in the general population, vulnerable populations, and first responders and healthcare professionals. We're also working with various hospitals on planning for a potential hospital surge. We monitor daily bed counts, ICU space, and ventilators on hand, and any other critical issues affecting the whole medical system as a whole. We're also working with the medical examiner's office, hospitals, and funeral homes to address the COVID fatality management aspect. There's guidance that's been provided by Dr. O in the care and of those deceased. Logistics and procurement has become a very large mission for the Emergency Operations Center. We've established a single point of ordering for the entire El Paso County. We're supporting all public safety with their requests for personal protective equipment. And that also includes some of our nonprofits that are doing food drives or working with the public to provide critical services. We're also in communication with our critical infrastructure, our utilities, our 911 systems, ensuring that they have their continuity of operations plans. We're communicating with them once a week to make sure that we don't have any impacts there. And then also the city-county continuity of operations of the essential services that have been defined both by the county and the city is ongoing. And last but not least, our disaster recovery and cost tracking. So with the declaration at the state, local, and federal level, there is reimbursement. So working with the county, we are ensuring that we have captured all of our costs for potential reimbursement by the federal government. Also, we have our Joint Information Center that was stood up along when we activated the EOC. And the Joint Information Center is our public information arm of the EOC. They help us deal with rumor control. They coordinate our press releases, our press conferences. They manage our social media, marketing of messaging, coordinating media requests and inquiries and information. They're also overseeing the COVID hotline that we established with the Department of Public Health and 211. So that's just a quick operational overview of some of the ongoing missions that we have here within the EOC. If y'all have any questions, I'm ready for those.
Commissioners, any questions, comments?
Well, this is Commissioner Robinson back again. The
Go
question
ahead,
that I raised in regards to the sanitation workers, I didn't get a affirmative response to that that question. As far as a minimum, we'd like to look at that for what safety measures are in place now, and what additional safety measures need to be imposed or provided to those individuals who, you know, we talk about the healthcare workers who do a great job. They're hands-on with the patients in the hospitals and the medical clinics, et cetera. So they're directly involved, direct contact. But by the same token, those individuals who are sanitation workers, maintenance and sanitation workers, they are directly involved as well, exposed to those elements as well. And particularly could be astronomical because their exposure is hands-on a daily basis in the midst of picking up the waste from the hospitals, medical clinics, from our homes. We need to have someone look at that and have it give me a more affirmative response there too, because I didn't hear one.
Yes, sir.
As well as we need to recognize those individuals who provide that service.
Chief Rodriguez?
And I will follow up with our Environmental Services Department to see what exactly they're providing for personal protective equipment. However, we are supplying all essential personnel with masks and gloves, whoever is on duty, since we've gone to that, to trying to use masks for every essential worker. So we are getting those out. I will follow up with them if they're taking any additional protective measures to protect, like you said, you know, they're very critical. And I'll follow up and have a better answer for you.
Thank you, Chief. Thank you, Chief. Any commissioners? Commissioner Pettis?
Thank you, Chief. My question was regarding PPE, the logistics and procurement of it. It's something that we had discussed as a court last week. We had heard in a meeting, I guess, from last Friday, I guess, so all procurement and everything requests, are they all being filtered through you and is sort of the one individual that's placing orders? I know there's shortages of virtually, all across the state and all across the nation. But, something that we were discussing is how, we can perhaps help from a policy perspective. How are those purchases and being handled and prioritized? But then are we also looking at other ways, perhaps any local manufacturing efforts that can be done? Can we as a county enter into a local economic development agreement with a potential manufacturer of PPE? Those are the types of things that we're seeing if perhaps we can assist. But how is that procurement and logistics, I guess, work in terms of managing all the needs and prioritizing those needs?
Okay. Yes, sir. Thank you for your question. So when it comes to the management and prioritizing of personal protective equipment, we work closely with BORDERAC, the Border Regional Advisory Council. They are our tie-in from the EOC, from the Emergency Operations Center. They work closely with all the hospitals and medical facilities, to include all the dialysis centers, the nursing homes, just the broad medical community. They have been receiving personal protective equipment from the state and from the Texas Department of Emergency Management. They've been receiving several pallets of PPE. They, in working with Border Rack, we separated our areas of responsibilities when it comes to personal protective equipment. Border Rack is handling any requests through what we call a 213 form. It's an ICS 213 form. Any of those medical facilities that have a need can submit theirs to Border Rack. The EOC, we've been working with our public safety partners to do a needs assessment, and we captured that the last week. And so any PPE request from public safety is coming directly into the EOC, into our logistics section chief that we have staffed here and his staff. So we're managing those within the Emergency Operations Center. We're making sure we're not duplicating efforts through within Border Rack. If we can't fulfill the request ourselves, and or Border Rack can fulfill the request, then we submit what's called a STAR request to the State Operations Center, and they will fulfill those as best they can. Across the State Operations Center, they're receiving multitude STAR requests from some of the larger jurisdictions as well. So we're competing against those. But we have submitted a total of about 5 STAR requests, some of them for personal protective equipment, some for lab supplies, and then some for personnel for the food banks specifically. Now, in regards to working with local manufacturers, there is a committee that's been established by the MCA through Ms. Emma Schwartz and her team. They're looking at some of the supply chain logistics and to see if there is some avenue that we can pursue to try to get some local manufacturing of some basic personal protective equipment. There are a few that have reached out to our EOC and given us some of their specifications and some of the things that they're putting, and we're pursuing all every available vendor throughout the world that is offering any type of personal protective equipment that meets our specifications. So we're aggressively doing that every single day. And the only issue with some of the local manufacturing is if they can make it to medical grade quality, then that's something that we can definitely use. But we have a lot of individuals that are doing either printing 3D math or just doing more types of PPE and other things that are more just for the general public. So we are putting those in queue, and as the requests come in, we try to fulfill them as best we can.
And Commissioner and Chief, this is Commissioner Stout. I actually have I asked Jackie Butler from the MCA to be on the line for today's meeting to give us an update on some of the work that they're doing right now regarding what this exact topic. And so I don't know if you all want to hear that now or if you want to hear it a little bit later, but she's on the line for us.
I have to reach out to her.
Could we have Commissioner Chief complete his presentation, because I know they've got a lot of things on their table. So if Chief Rodriguez, any further comments, or from the commissioners, something that we can allow both Dr. O and Chief Rodriguez to leave they need to get to some other issues and tasks.
Judge, I have a couple of questions. So I had posed a question beforehand regarding some of the demographics, and I don't feel like I got much out of that, but maybe that's something that I can be sent offline or by email. But I think it's really important for us. I wanted information on where folks are, these folks that are testing positive, they're working, what their race is, what their nationality is, the language, if they're primary Spanish speakers, I think a huge one is whether or not they have disabilities or pre-existing conditions, and whether or not they have health insurance and are going to be able to pay for things. These are all important questions for me as we move forward. And I hope I can get that information from y'all. I mean, I've heard that a lot of those things you may be tracking already, and if not, I think it's something that we need to start doing. I think in the in the light of the fact that we just don't have the broad testing capabilities that other communities or other places may have. I think there are other things that we could be doing, and we may be doing. I just don't know if we are or not. But obviously, the social distancing is important. And I don't know if the fact that we're still on a very steep incline of that curve. I'm not sure if there's something else that can be done more deeply to help with that. Because if you look at the graphs and you look at the numbers, we're still moving up. We haven't flattened anything out, and I know that folks are predicting that in a couple of weeks it may flatten out. But I just feel like we need to be as proactive as possible. And so another thing that I think is important is that I've seen done in other communities has to do with contact tracing. Are we doing a lot of contact tracing, Chief and Dr. Ocaranza? What does that look like for us?
So,
Dr. O, do you want to go first?
Commissioner South, thank you for your. I'm sorry, Judge. Go ahead.
And I was saying that I don't know if that was a question to Dr. Ocaranza or to you, or let's have you finish off, Chief Rodriguez.
Okay, I'll address part of this question. And Commissioner South, thank you. We did receive your question. Now, in regard to part of the epidemiological investigation and monitoring, so some of that information is captured, but traditionally it's not. They're focused on that contact tracing, like you said, and that's focusing on the contacts that either positive or potentially positive individual usually begins with their immediate family, and then that line of questioning on where they, who else they might have been exposed to, either in a workplace or in a social setting. That's all part of it. So something that we've taken on quite aggressively has been the expansion of that contact tracing. So originally, the Department of Public Health had 7 epidemiologists as daily staff. Within the last 2 weeks, we've increased that to about 135. Really, just a very large organizational chart to address some of this contact monitoring, to triage some of those patients, and then actually conduct investigations. So we're doing that very aggressively, and to keep up with the pace of the cases that we currently have. So that level of commitment to contact tracing, to me it seems it's unheard of that we're doing it in such an aggressive fashion. So that is part of the containment strategy, is ensuring that that those contacts are monitored, and that each case is managed, and that we have that optimal span of control between investigators, people that are doing the triaging and monitoring. So that's a little bit. I'll have Dr. O speak a little bit on it more. Thank you.
Thank you, Doctor.
Thank you very much. And as Chief mentioned, we've aggressively expanded all the epidemiological capabilities to do more contact tracing and actually monitoring. And the message that we have given the community is that everybody, if somebody in the household is positive or is sick, everybody needs to stay put at home because they're considered to be positive. And that's when a lot of the spread happens, when somebody in the household doesn't feel sick and start going out and doing all those non-essential activities. We do take a look at different aspects of how each contact interacted with other people, whether it was through social gathering, it was through work, and we try to establish any linkage, and that's how we come up with any possible clusters. As you mentioned, Commissioner Stout, the widespread testing is one of the ways that we can see how the community has been affected, and the fact that the virus hasn't mutated. Once somebody's sick and gets immunity, that person is not going to get sick again. And that's one of the ways that we can see how we have been affected, because some reports say that for every person that tests positive, there might be another 6 that could be positive. And the one thing to remember is that the numbers of the people that have tested positive is a small representative sample of what we have been doing in the whole city. When doing research investigation, and especially this epidemiological investigation, the number that we provide is not an absolute number that what's happening in the community. But what we know is that, as you mentioned, we're going up in the curve, and we will continue hearing positive cases, and we need to see how these cases are not either we have less positive cases, and that's what we see, that we might be reaching the peak or plateau. As far as doing any kind of inferences on demographics and how the people are being affected, initially they were asking why we have more females affected than males. We don't have enough numbers to make those to be representative of the whole community. And the demographics of El Paso are very particular as well, because we have very skewed demographics in many ways. Definitely, what we know is that the fatalities that we had in the city, they both had pre-existing medical condition that made them more vulnerable. And that's why we try to protect everybody in the community, but pay particular attention to those that can develop severe complications, because we don't want them to be affected and continue to see a rise in the case fatality rate in our city.
Thank you both for the answer. So I just want to make it clear that we are making sure that people are staying isolated. When we're doing the contact tracing, we are making sure that they are staying isolated. That's right.
Definitely. And one also very important thing that we need to tell the community: if people get tested when they have no symptoms, the CDC mentions that the rate of asymptomatic COVID-19 patients is about 20%. That means that 1 of every 5 might be positive and might not exhibit any symptoms. So if at any given point in time somebody with no symptoms get tested and it's negative, it will give them a false sense of security that they can go out and start doing a lot of activities outside of their home, when in reality, this can cause a lot more problem as far as the community spread, because we know that probably about 48 hours before they start exhibiting symptoms, that's when we can identify that there's going to be some virus shedding. So that's why if the people get tested because they get scared and they're asymptomatic and they were not exposed, or they have no other risk factors and they're negative, they might feel that false sense of security. So that's why if there's somebody symptomatic, then we test them. If it's positive, then we're going to be isolating them. But if we have somebody positive in the household, let's consider everybody in that household to be positive, so they need to stay isolated. So that is going to give a lot more positive results, and it's going to help us out. But thank you, Commissioner Staff, for all that insight in your question.
Yeah, thank you, and I wanted to thank y'all as well. I know that the chief mentioned that y'all are utilizing hotels and such for isolation, and we've talked about that in the past here. How deep or how much is that actually being used? I mean, are folks actually isolating in the hotels, or are they mostly just are we still just having them stay at home?
Chief
Well, most of
Rodriguez?
the community, we tell them to isolate at home, but for the homeless population, which is a very unique kind of population, that's what we, in conjunction with the Office of Emergency Management, who establish all that process of putting some people in the hotel so they don't come back to the shelters. And instead of having 1, 2, 3 people that are sick, we're going to have 100, 200, 300 people sick at the same time. So
Right.
it is something
That's the
that
homeless
has
population,
been.
though, right? Not the general population. So it's mostly being, the hotels are mostly being utilized by by folks in the homeless population as opposed to just the general pop.
Yes, sir. That is correct.
Okay. Thank you. I don't know if I have any other questions other than what are we doing for disabled folks who may not be able to get to a testing site very easily? I know that I've heard on Fort Bliss they're sending people door to door. I mean, is that something that we're doing or that we're considering doing if we haven't started it?
Yeah, let me have Chief Rodriguez explain a little bit more as far as that.
Thank you.
Thank you.
So that is definitely, thank you for your question. That's definitely one of the strategies that we want to employ. We're trying to secure more swabs that we can do that, working with our home health agencies. We've done that to some respect out of the drive-through. We've had a few instances where we've had people that through a request, and it's something that we can work through right now. If someone calls and makes an appointment or tries to make an appointment at the drive-through and they explain their circumstances, they have personnel on site that can go out and collect that specimen from the residents, or they will work with their home health agency and provide them with a swabbing kit so they can collect that specimen in their homes. But it is something that we're looking for. We're looking for alternatives also for transportation, working with some of our nonprofit partners to see if they can provide some of that transportation for those that may have some disability. But we are actively looking at expanding our capability to do more in-home testing. But again, the supply of the kits is one of the challenges in meeting that.
Well, if that's something you all need assistance with, maybe that's something that we can help at the county with whether it's our transit system that I know that we're also utilizing to help with the homeless transportation, but and also, I mean, I know that other communities have been talking about trying to bulk up the workforce in y'all's area, when it comes to public health, maybe utilizing folks from AmeriCorps or the Peace Corps. I know those are federal programs, but if something like that doesn't materialize very quickly, if you all need more personnel or folks that can help, maybe that's something that the county can be of assistance when it comes to resources. I don't know. That's something we'd have to talk about, but I just wanted to put that out there.
Yes, sir. Thank you.
Betsy, would you lead? That's a good insight. So Betsy, if you could do try to follow up on what's available and what we could do that addresses Commissioner Stout's recommendation, or at least a suggestion on what we could do from the county.
Yes, sir.
Okay, and well, thank you both. There's two expressions that when you want to find out, the level of leadership, and one of the questions is that we should ask ourselves is, if you were in war, who would you want in your trench? And secondly, who would you like to pack your parachute? And I can tell you, in both cases, Dr. Ocaranza and Chief Rodriguez, I would want you in my trench and I would want you packing my parachute. I can guarantee that. This is one of the best 1-2 punches that you could see. They're actually in the same office. They work together and they complement each other tremendously. And I don't want it to sound like I just throw out kudos to people, because these two gentlemen are just way ahead. Passion-wise, background, every dimension. These two gentlemen have been very helpful. We thank you. I understand you've made a commitment to be on Commissioner's Court every Monday to give us this type of feedback that is very valuable. I hope this also allows people to understand the kind of information that happens in this broadcast and have more and more people tune in, because there's some very valuable information. One of the things that we've seen is that we really believe that people are getting the information through TV and other means, but unfortunately what we've assessed is a lot of people streaming Netflix and all of these that sort of not looking at the news as much as we'd like, or getting into some of the information that is very valuable. So hopefully if people, let people know that I think we cover things very well, very professionally, and very succinct and efficiently. So thank you both for that commitment to be with us and to continue to do this going forward. So Miguel, if we could bring, who did you say? Commissioner Stout would be on the line?
Jackie Butler will be joining us via phone. I'm going to dial out.
Jackie Butler from the Medical Center of the Americas.
Thank you for doing that. Miguel?
I am dialing up.
Hello.
Hello, Jackie. This is the Commissioner's Court. You can address the court now.
Okay,
Jackie, welcome.
Hi, good morning, Judge, Commissioners.
Good morning.
Good morning.
Thank you for having me today. Hope you all are well. So I was asked to provide an update on what the MCA and Bio Paso Juarez have been doing. Sorry, I'm having trouble hearing.
Yes, go ahead.
Okay. The MCA has been coordinating a lot of activities on the public health and PPE needs coordination over the last several weeks. What I wanted to do was give you just a brief update on what Bio Paso Juarez has been focused on. So Bio Paso Juarez is the industry organization for the regional medical device manufacturing sector. We have over 10 medical device manufacturers as part of the membership, and you may or may not know, but there are over 30 medical device manufacturers in El Paso and Juarez. So about 4 weeks ago now, we sent out a survey to the regional manufacturing sector, asking them if they were already producing PPE or if they had additional capacity to do so, and also trying to understand what their limitations might be in terms of any supply chain disruptions or other types of issues that they're dealing with. A lot of the medical device supply chain comes out of areas in Asia and across the globe, and so as we expected, a large portion of the manufacturers did indicate that they were working through some supply chain disruptions that were impacting their abilities to either manufacture more or to shift operations for PPE production. All of that has changed pretty rapidly. We've seen that most of the manufacturers are ramping up production regardless of whether it's PPE or not. A lot of them are seeing increased demand for all types of medical devices and equipment. We have seen mostly from the contract manufacturing sector, so more locally owned manufacturers that have been able to transition to PPE if they weren't already making it, or were able to ramp up production in those areas. Some of the supply chain obstacles have loosened up a little bit as China gets back online, but there are still some major obstacles since the entire world is trying to source the same kinds of personal protective equipment. And so we are still in the data collection phase. We're trying to understand on an ongoing basis how the manufacturers' capacities are changing and whether or not any of what they're producing is being set aside for local distribution. One of the factors that we have to keep in mind is that most of the manufacturers are in Ciudad Juárez. And so the ones that have been able to either shift production or increase production of PPE have already, I guess, earmarked some of that for Ciudad Juárez needs. Last week, we participated in a call with the MCA and the Office of Emergency Management and Border RAC and a lot of the healthcare institutions to see if there could be a coordinated effort to understand by community what the total PPE needs are. Not that we believe that the manufacturing sector could completely fill any of those needs, but it would help the manufacturing sector to understand what the quantities are that are needed, so that they can either tell us which portions they would be able to fill in those gaps and in which communities they would be able to do so. So that's primarily what we're working on. There's another portion of this that has a lot to do with advocacy. So we're doing our best to bring awareness to what the medical device manufacturing sector's role is in protecting the community and keeping the community safe. Just as there are with the healthcare sector, there's workforce needs that the manufacturers have. We're concerned about keeping the manufacturing workforce healthy and safe, both here in El Paso and Juárez, so that they're able to operate at maximum levels. And then there's also concerns about essential businesses being able to remain open. A lot of the supply chain for medical device equipment and PPE comes from manufacturers that aren't necessarily considered medical, so maybe electronics components for ventilators and the such. And so we're looking closely and working with the U.S. Consulate's office in Juárez to see what we can do to make sure that supply chains remain as open as possible for those kinds of needs. I'm happy to answer any questions if anybody has any.
Jackie, I guess it's one great indication of a lot of things that happen behind the scene that people are not aware of, and what you guys are doing. And I have communicated with Emma Schwartz. It's just amazing. A lot of the questions that we have and a lot of things that you're addressing are really things that are proactive. Because we really need to understand the supply chain and how that could hurt us in the future. I don't know, this might be out of that scope, but one of the calls I get a lot is that there's certain businesses that should be now essential. And I'll just give you an example of people saying, like, Hobby Lobby, right, has a lot of cloth and they could produce masks and they could get into that. And I haven't gotten a lot of traction. So I don't know if you could sort of, not now, but give us an understanding of maybe some of the, not necessarily manufacturers, but people that have certain products or things that we could use in the future. And then that would help me if we need to address non-essential businesses becoming essential, then I would be a little bit more prepared. So anything that you could do to help me understand that. There's others like blankets, for example, people that produce things that are now closed, but would be valuable going forward to provide things for the homeless population and so forth. So those are some of the questions or people are asking me in the future, can they become an essential business? But I would have to have a lot of background and information, both from the legal department, but also from the community like yourselves, of understanding what is out there in our community that we could shift towards helping with our crisis and lack of equipment and so forth.
Yes, Judge. I would say there are quite a few of these makers and innovators who are utilizing these kinds of materials that can be bought from retail spaces to repurpose them for masks and other kinds of personal protective equipment. We are coordinating with several of those, so I'm happy to work with them to see if we could get you a list. From the manufacturer's perspective, I believe most of them are focused on medical grade equipment. And so just to give you an example, the material that Cardinal Health, for example, uses on their respirators, the N95 respirators, most of that raw material is sourced out of China. And so they're looking at alternatives like coffee filter manufacturers and those kinds of things that everybody's having to think outside of the box for. And so if we hear of any of those instances where maybe a supplier or a business that wouldn't necessarily be connected to the manufacturing sector but turns out could be, we will definitely let you know.
Thank you, Jackie. Anything else, commissioners? Well, Jackie, we want to thank you. We have some great partnerships, and MCA has been a big one. So thank you very much for that update. And if you ever need to continue communicating to us and updating us, so you're very welcome to reach out and help us during all these things that we have to do to communicate, and also the partnerships that are required in our community. Jackie, thank you very much for joining us.
Thank you all very much, and thank you, Commissioner Stout, for the invitation to join.
Thank you so much.
Thank you, Commissioner.
Bye-bye.
Betsy?
Okay, Judge, if we want to continue with the Commissioners Court update, I don't know if you want to go ahead and let Commissioner Stout go through any other updates he has.
Absolutely.
We might, when it comes to immigration, I can just talk about, some of the meetings that I had last week. I had meetings with folks from Las Americas, with Hope Border Institute. There was a press event that occurred. Basically, I think we talked a little bit about it at our Monday meeting last week, but asking CBP and ICE to come to the table to talk about their plans for what happens if there's an outbreak within their facility, as well as looking at advocating for the release of folks that are nonviolent, that are there and that have not committed any crimes other than basically having violated immigration laws. And so I wanted to, after having those conversations, there were a number of things, of issues that came up regarding the immigrant community that folks would like us to work on, that we're talking about. And so one of the biggest I think issues is that the vast majority of immigrants are probably going to be left out of any economic stimulus that the federal government has approved. And so, you know, a lot of these folks are people that have been working in the service industries and the hotels and the restaurants, and probably disproportionately being affected by just the lack of work. And you know, we don't want people to become homeless, and that's going to cause more pressure on our homeless shelters and such. And so we're just kind of talking about what we could do to possibly help those help that community get through this as well. Also wanted to make sure that that the county is able to get information out to immigrants regarding services that they can access, regarding, you know, questions about you know, the stimulus, for example. Regarding, for example, there's been talk about this public charge issue where, you know, the federal government has said that if you're receiving, I guess, resources from the government in the way of Medicaid or food stamps and things like that, that could inhibit you from being able to become a resident, apply for your residency or apply for citizenship in the future. We want to be able to provide information regarding that, and, you know, in the context of COVID, from what I understand, that is people can get tested, people can go to food banks, people can still receive certain help without the public charge rule being applied. I think, you know, our county attorney, John Bernal, sent an email this weekend regarding some of that information, and trying to help make sure that folks are privy to that information, that they are informed correctly, that there's no confusion, and you know, making sure that folks are safe and are taken care of. And so, you know, we'd like to talk about manners in which we can diffuse that information, where we can get that out to them. You know, not everybody has access to the internet, and so, you know, we may need to look at you know, getting through to people through their cell phones. Most households probably have at least one cell phone, and so, you know, maybe it's something that we can work on, doing something called, you know, with geofencing, where we can push out information through text messages. It's something that can be done. I know that we've done some of that with our work with the Complete Count Committee through the Census, when we're trying to push out information to the hard to count communities. I know that the city has been utilizing these alert or emergency text messages that have been pushed out to all cell phones at a number of different on a number of different occasions. I think that, you know, we may want to you know, do something along those lines, so that we can make sure that everybody in the community, whether they're an immigrant or not, understands what first of all needs to be done. Second of all, how, you know, where they can get help, and make sure that they understand that there are resources out there for them. And so I know that we're in the process of still hiring the immigrant services position, and hopefully that'll come through pretty quickly. But in the meantime, I feel like there are a lot of things that we could be doing to be helping this, which is one of the most vulnerable populations here, and making sure that they have everything that they need. So I don't know if anybody has any questions or concerns about that. When it comes to the homeless, I think I'll defer to Joel. He may have a better idea and grasp on how things are moving along in that realm. So that's about all that I have at this point for y'all. I don't know if anybody has any questions or anything.
Commissioner Stout, thank you very much.
Judge, would you like to proceed to Commissioner Leon's update?
Absolutely.
Yes, thank you, Betsy. Judge, thank you. Just a few quick things. I think the most,
right back there.
the biggest question that we both all may have is the recent TDCJ statement letting us know that they will not be accepting any more prisoners or inmates. And I think the sheriff is on the line and he can talk about that. But a few things reference the constables. I know that Constable Ugarte has been involved with the OEM in so far as getting some PEE, and also with the Isleta del Sur Pueblo, who have provided personnel and the equipment to disinfect all their vehicles. So I think that they're taking advantage of them. They've received a supply of masks, gloves, goggles, and we have another one of our other constables, Constable Garcia, has also been responding to a lot of the red sands calls out there, where they've been able to disperse about 25 groups of people. These are not 25 people, 25 groups of people. So apparently some of the segment of our population hasn't really grasped the severity of grouping together. So they're out there, they've done a good job, and they're continuing to help with the food banks and the distribution of meals and food, also with the school district. So having said that, if the sheriff is on the line, I'd like for him to describe the impact that this TDCJ ruling may have on our county.
We have some representatives from the sheriff.
I'm here. I'm under Tom Whitten's profile. Can you all hear me?
Thank you, Sheriff. Thank you, Sheriff. We see you and hear you.
Great. So we were notified last week that they were canceling their Thursday and Friday pickup and that they would resume again on Monday. However, over the weekend, we received notice that they have stopped picking up inmates that have been convicted of felonies and are sentenced to TDC time. And how many do we have, Tom, that are in the jail right now that are waiting transportation?
About 62.
We have about 62 that are awaiting transportation. So I think typically what occurs, and Wally Hargrove is the one who tracks this, I believe, is that they have up to 45 days from the time that we submit the paperwork and it's approved to accept delivery of the inmate. And after that point, they're required to pay the county a reimbursement for each day. But it's not impacting us as far as room. We're perfectly fine. Before this virus, we had about a little over 2,400 inmates. We're at a little over 1,900 now. So we've got the room for them. It's not a problem with holding them until they're ready to start accepting them again.
Sheriff, this is Carlos Leon. I appreciate that. And I've got to say that we've all read issues arising in other county jails around the country, and it's been pretty serious. But I've got to compliment you in the way you've been separating some of these inmates, and as they come in, they're separated and held for about 14 days before they're introduced to the general population. So apparently whatever we're doing is working so far to keep the coronavirus at bay. I appreciate that. Thank you.
Thank you, Commissioner. And that's exactly right. So when an individual is booked into jail, if they're able to bond out or they receive a PR bond, they're released from the facility. If it looks like they're going to be housed in the facility because they're unable to make bond, then they're housed separately in a single cell at the downtown facility for 14 days. And then once we're sure that there's no issues after that 14 days, they're moved to the jail annex. So we've been really lucky that so far we've had 0 cases in the jails at this time.
Thank you.
Can I ask you a question? This is Commissioner Sal. Can I ask you a question real quick, following up on that? When it comes to the segregating of new bookings, you said that if they're able to get a bond and you know they won't be put in segregation. But what about those that you know maybe it may be that they're able to bond out within a couple of days or I mean I don't know if there's any way that you can tell, or if you're looking at the crime that they're accused of committing or that they've been arrested for, you know, if I guess my worry is that, you know, if you have a number of folks that are in that, you know, isolated population, you know, I think it's good. I think it's a great idea what you're doing to make sure that they're separated from the general population. But do we have folks that are you know, bonding out that have been put in that isolated population and that are bonding out before the 14 days are over?
Right, so we can't anticipate in the future when somebody might be able to bond out. The ones who are given a PR bond or are able to post a bond immediately are not sent into the isolation, and so everyone else goes into a separate cell. They're isolated. If they bond out in 2 or 3 days, then they leave, but they weren't interacting with anybody else. So if somebody else in the facility may end up to be positive, they would not have interacted with that individual. So we're confident that when they're leaving, they're not leaving with anything they picked up in our facility. And by the way, we do have people that come in the facility that show symptoms. We screen them outside the facility, and people who have symptoms or answer the questions indicating they may have been around somebody with the virus or they have a cough are immediately taken up to our medical ward on the 10th floor and are seen by medical personnel and are given the proper PPE to ensure that we don't spread it in the facility. We've had 4 individuals who have had the symptoms, and they've been tested, and all 4 have come back negative. So again, I think we've been really lucky up to this point.
Thank you for that information. How many folks do, I mean, I'm sure it changes on a daily basis, but is there like a ballpark number of how many folks you have in that are isolated?
Yes, there's 70 at the downtown facility. We get a daily update on the numbers, and we have 70 at the downtown facility that are currently in isolation.
Okay, and are new bookings still going down, or because I know that, you know, a couple of weeks ago we had a report that they had gone down, but I just wanted to see if you have any information on the booking volume.
Yes, so we're still open for business and we're accepting inmates. The federal bookings have gone down considerably. They're usually less than a handful a day. As far as from all the other law enforcement agencies here in the county, including the city police, the sheriff's office, and the constables and the other small cities, the bookings are down probably 10 to 15% pre-virus. So there's still bookings occurring every day.
Okay. Well, I just wanted to make the commentary that, you know, even the state, the TDCJ is no longer accepting new arrivals in their jails, and so I know that we're doing quite a bit, and I really appreciate everything that y'all are doing. But if there's anything else that we can be, you know, I would strongly advocate for doing that if that's possible.
Yeah, I understand your concerns, and I actually agree with what the Texas Department of TDCJ is doing, because they're accepting inmates from almost every county, and they don't really know what type of procedures that county has in place to prevent an outbreak in their facility. So they could take people from El Paso who do not have the virus, and then be pulling people from some other county who do, and then they put them together, and of course, what's going to happen? So it kind of makes sense to me right now that TCJ is doing what they're doing, although we're hearing that they're working on some protocols so that they can start accepting again. I don't know what that's going to be. It'll be interesting to see. But I think we're doing everything we can to reduce the number of people coming in. I think the jail magistrates are doing a good job of giving the PR bond to those nonviolent, low-level misdemeanors that don't have a violent background. And I know that in bond hearings that's attended by the district attorney and the defense attorneys, that the issue of COVID is brought up quite a bit, but the judges, I think, are doing a good job to make reasonable decisions on who should and should not be released into our community.
Thank you, Sheriff.
Sheriff, thank you. The logistics involved in what you're talking about are just tremendous. And thank you, Tom, Kevin, and everybody, your team, for that logistics. And it isn't an easy task, so thank you for all your effort. Commissioner Leon?
Yes, I'm sorry to interrupt. Thank you, Sheriff. I appreciate that. I had a conversation with Chief Roger Martinez at JPD, and I think he's on the line. Very critical information that we need to put up. Chief Martinez, is he on the line again?
Double checking. 1 second.
While he's checking that, Judge and Commissioners, we did have a positive test come up on one of our JPD employees, and that's why I'd like Chief Martinez to go into some of the details.
Commissioner Leon, I know we had someone from JPD. I believe Louis was on the phone, Miguel,
Correct.
Or on the Teams meeting.
And Mr. Martinez.
I'm also here, Betsy. This is Roger Martinez.
Oh, great. Thanks, Chief.
Thank you, Chief.
Chief Martinez, I don't know what I just explained to the court, but could you go into detail, reference that employee?
In reference to the, I'm sorry, I didn't get that.
We were talking about that you did, in fact, have an employee test positive for the virus?
Yes, sir. That we found out Friday afternoon, this past Friday on April the 10th. He did contact us to let us know that he had tested positive. We did inform the state immediately because we had transported 3 youth to the Ron Jackson facility in Brownwood, Texas. They, in turn, immediately were testing the youth upon their arrival. They tested them. And on Easter morning, I did receive a text at 6:37 saying that the 3 kids were negative for COVID-19. The staff member himself is at home recovering and in good spirits. What we've done is we have also implemented a quarantine there in the detention center. We have been working very closely with Dr. Zait from Texas Tech. She is our pediatrician that's been assigned to our department for a number of months. Her background is in correctional facilities, specifically for juvenile correctional facilities. So she's been guiding us through the medical aspects of things going on with the coronavirus. So since then, Well, let me take you back. What we've been doing now for the last 3 weeks, every person coming into the building in the detention side of the house, or the facility side rather, have been temperature taken, asked the 3 questions by the Center for Disease Control, checked to make sure that they're healthy before coming in. They have been sanitizing their hands with soap that was provided to us by Texas Tech, which is surgical soap, which takes it to an extra level of protection that the nurses have described to us. All of us were trained on how to wash our hands effectively and going to the back, and of course practicing social distancing amongst the department or amongst the kids in detention as well. I know that with this particular individual, he has not been at work now for since last Saturday, a week ago Saturday. So it's been 7, 8, 9 days that he's not been there. We have spoken with the doctor this morning, and she's going to be providing more recommendations to Mr. Castillo there at the department as to next steps that they're looking at. My understanding, preliminary, is that to continue the quarantine of the youth, they do have their individual rooms in the pods. They are being checked for temperatures and any type of symptoms. But if they seem to show symptoms, at that point, I believe this is when she advised that we could do any type of testing. Going back to the transport of those 3 youth that went out, that represented 2 of the 3 open units, and they came back testing negative. So it gives us a little bit glimmer of hope that maybe that's going to be the same thing with the youth there. All the staff have been, they have their protective gear. As of Friday, we made it mandatory that everyone wear masks in the back. They do have access to gloves. We also have received our first order that came in about 6 weeks ago of the personal protective equipment that we have, but we are in a back order for 6 weeks of other items that we've asked for that have not yet come in. So at this point, we have about 2.5 to 3 weeks of personal protective equipment for staff. I know Mr. Castillo did advise the staff as well to bring in cloth type of masks if they have those available, but we will utilize everything we have until we run out and or that we're able to get more of a supply to come in. But again, this was ordered 6 weeks ago prior to these things coming into play.
Just one quick question, Chief. And it looks like you've got a very good handle on this situation. How are you handling visitation, parents and friends that come visit some of the juveniles that are housed there?
There is no visitation at this time, personal visitation. We do have phone calls, where they're making phone calls from the units, and that does not cost the youth to do that. Our phones are lines that go directly to, if it's a parent's cell phone or their landline, but there's no cost to make phone calls out of the facility. We are working diligently with IT at JPD to be able to try to Skype and or have some sort of facial recognition to have face-to-face type of conversations with their families. And I know they're working on that now for both detention and challenge. But they've had extra time given to them to have those phone calls. The only ones that do or have been allowed to come in will be the child's attorney if they need to speak with them, but that's been very limited. We have not had very much of that at all. In fact, in the detention area, we've set up a virtual camera to have virtual court. This we don't have to move kids to and from buildings and keep them there in the same facility and have court from there. And it goes virtually either to Judge Gutierrez, Judge Ligon, or Judge Ainsa. And so we're trying to minimize any type of movement as much as possible. But going back to your initial question, we don't have any visitors coming in. We have no interns. We have no volunteers. We have no religious services people coming in at this time. It's just strictly staff to the department and or attorneys as needed. But again, making phone calls to the parents in regards to this. Also, just to make you all aware, we did notify all the families on April 11th about the officer being diagnosed with COVID-19 as well. So the parents are aware. Our population is low. We are at 20 youth right now, 18 males and 2 females. So that helps us considerably to have that low population at this point.
Thank you, Chief, and I appreciate what you're doing. And as always, as the judge mentioned earlier, I'm just astounded with the type of leadership that we have. Thank you.
Thank you, Commissioner.
Chief. Thank you, Chief, for your comprehensive approach and your alignment. I know visitation has been so difficult, and in every people not being able to go see their loved ones in the hospital. We have in adult, in some of the facilities for senior care. It's just been very difficult, but thank you for being proactive in your alignment, not only with the order, but also with what Sheriff Wiles is doing and his team. Thank you, Chief Martinez.
Oh, thank you, Judge. I appreciate that.
Commissioner Pettis?
I have a question for the Sheriff's Department. So far, there have been no positive tests.
Questions like, how many
That's unmuted.
Go ahead, Commissioner.
So far, there have been no positive tests in either the local population or the federal population?
That's correct. So there's been 4 inmates that have had the requisite symptoms for testing, and those 4 tests have all come back negative.
And then are there any inmates who were in the jail prior to these protocols, prior to everybody who enters the jail is going to be isolated for 14 days? Is there anybody, let's say, who was there for a month, or something like that? Has any of the other inmates had to been isolated at this point?
So we do from time to time have inmates who experience illness. And if it's anything related to a cough, a sore throat, a fever, we immediately remove them and isolate them. As a matter of fact, one of those 4 was an inmate at the jail annex that did not go through the 14-day quarantine because that was previous to it being implemented. And it turned out that she had, so her COVID test came back negative. It turned out she had the flu, is my understanding. So we do from time to time have inmates who get ill, and if they're experiencing symptoms that could be the COVID, they're immediately isolated, and if they meet the requirements, then we go through the testing. They'll give them the test.
Okay, and then regarding federal inmates, there's jails across the country that are having problems. For the most part, are all the inmates on the federal side local, coming from our area, or any being transferred from outside of El Paso?
No, my understanding is they're all coming from the local agents.
Okay, and then has anyone in our workforce had to self-quarantine if we've had inmates who have had to quarantine?
So we have about 10 employees right now that are self-quarantining. Most of those are travel related. One, I think his mother tested positive, but he was not living in the household, but had visited, and he's self-quarantining. So yeah, about 10 employees who we have right now that are being self-quarantined.
Okay. And I guess if there is somebody coming in through the booking process that, let's say, showing perhaps all 3 symptoms, if they have a cough, fever, shortness of breath, whether let's, for example, if they're federal, do you have the option of telling whatever booking agency, similar to what TDCJ has done to counties, of saying, we're not going to take this inmate if they're showing symptoms?
We wouldn't do that, and that's based upon advice of our medical advisor from UMC. They feel that if somebody were to come in showing the symptoms and it turned out that they did have it, that we would be better able to confine it and treat it in an isolated cell than we would if we force them to release them back into the community or to take them to one of the hospitals. You know, I had a call the other day about a homeless person that they were testing. And they were worried that if the person came back positive, where that homeless person would stay because they were not going to admit him to the hospital. And I think we could come, and luckily that person ended up testing negative. But I think the same issue could happen if you have an arrestee showing up at the front door who's got the symptoms, and we refuse them, they go to the hospital and test positive, and then what's going to happen? The arresting agency is going to just release them back into the street to infect other people. I think, and I agree with our medical advice that we're getting, if they come into the facility, we give them the proper protection, we isolate the individual, we have 24/7 medical care in the facility, and we're able to confine it, control it, and treat it better than just to release that person back into the general community.
Okay. And how is the collaboration with other agencies? You know, I mean, one of the more frustrating things has been, you know, the Department of Defense has not really released, well, they've stopped reporting numbers, you know, as it pertains to the number of folks that are infected. So certainly having a large military population here, I mean, if there is a case where, let's say somebody on post is arrested, I mean, are they sharing any kind of information pertaining to any perhaps prior testing or exposure to that individual who would be a federal inmate and wind up in our facility? Are they sharing that information with us, or are they not so much?
Well, the Fort Bliss does not book inmates into our facility, so all of the inmates coming in are coming through federal agents, of course, under the federal contract, and then any local law enforcement. And everybody's been very cooperative as far as we know. And the screening process, again, that takes place right outside the side door where the arrestees show up, that process pertains to not only asking the arresting officer questions, but also the arrestee, and also checking temperatures and things of that nature. And by the way, a lot of the PPE, well, I would say like pretty much 100% of it, the arrestees are coming to our facility wearing a mask. So the arresting officers are placing masks on the arrestees as soon as the arrest is made. And so when they transport them to the jail, they come in with the mask on. And so they're doing a really good job, I believe, of helping to keep any potential spreads from occurring. But for right now, we do not have any reason to believe that the arresting agencies are not cooperating fully and providing all the pertinent information we would need to know about that arrestee who's showing up at our door.
Okay. Yeah, because I would hope that each agency has their own protocols, I guess, in terms of testing and taking temperature and things like that before, you know, we shouldn't be sort of the first agency conducting screening. I hope that they're conducting screening before that they're being transferred, you know, to us, or before they're going into the booking phase. But again, hopefully, you know, with the various agencies, they're doing that. That's just one concern I had.
Thank you, Commissioner. Commissioner Lone, back to you.
That's it for me, Judge. Thank you very much, Court, Sheriff, Chief Martinez. I appreciate it.
Thank you.
Thank you, sir. Judges, Commissioner Robinson.
Commissioner Robinson, go ahead.
Yes, sir. I just wanted to just a couple comments in regards to the sheriff and the sheriff department. Just wanted to say that I appreciate the cooperation and collaboration in the professional judgment that's exercised by the sheriff and all his officers within his jurisdiction. We have one of the best sheriff departments in the nation, and we need to make sure that we applaud them and make sure that we get it all the support we can. So, from my standpoint, Judge, wanted to say to the sheriff, you keep on keeping on.
Thank you, Commissioner.
Thank you,
Betsy?
Commissioner. I appreciate it.
Thank you, Sheriff.
Thank you.
Betsy?
Yes, sir.
Judge,
we're ready to go.
Judge, after Betsy talks, I'd like to make comments in regard to the homeless situation after Joel makes his presentation.
Absolutely.
Okay. So if you'd like to go to Commissioner Perez for his update.
Absolutely. Go ahead, Commissioner.
Sure, mine will be brief. I had a conversation with Jacob, telling him about what we had spoke about during Commissioner's Court. He informed me of all of the activities that they're doing through Border RAC, the collaboration that they have with Ready One. Ready One has converted some of its manufacturing processes to help provide PPE. He also mentioned that they're working with a maquila in Juarez who has some PPE available, but I'm still waiting on some information they're going to provide me, I guess, regarding a list of needs and / other efforts that they're currently engaged in to help secure more PPE, and from that we'll be able to determine if there's any opportunities for collaboration on our part. There were other things that he mentioned, that perhaps that we could look into with things like barbershops, hair salons, and other things. There is a need at hospital. I don't know if that's been addressed yet, but there is a need, and perhaps that to have a mobile unit out there for some of the healthcare professionals, who are out there, on the front lines, dealing with patients and working with patients. Things like childcare is another issue that he mentioned that they're working with the El Paso Independent School District. But once I get that list from UMC, I'll have a better understanding of perhaps what other areas from a policy perspective that we can lend assistance. So that's what I have so far.
Thank you, Commissioner. Betsy.
Thank you, sir. Yes, sir. If we could go back, Miguel, to the presentation. I believe we've heard the update from the Sheriff's Office and Juvenile Probation. Now I'd like to move to the update from the medical examiner.
Thank you.
Dr. Rascon.
Thank you very much. Can you hear me okay?
Yes, sir. Welcome.
Thank you. Thanks, Judge, Commissioners. So I have asked IT to manage the slides for me. There's only 3 slides, so hopefully there's not too much confusion. So in general, the OME has remained close to the public. However, we do have, our 24/7 operation on the investigative side. We have all of our administrative personnel working from home, and we are still in touch with the community via, answering messages. So if someone calls the office, gets a voicemail, leaves a message, and then an investigator calls them at a later date. And we also continue to do the admin duties, namely the signing of the death certificates and signing cremation permits, which in turn allows to, the debt services to carry on as close as to, normal baseline. We developed standard operating procedures to deal with this crisis, namely on scenes. We have, updated or enhanced PPE measures while on scenes, and we have implemented a protocol for triage to figure out which cases we would test for COVID-19 or the COVID-19 virus, that is. And I'll expand a little bit on that as part of our fatality search preparation, which includes several points. So number one is we have reached out to hospitals and offered guidelines on how to prepare bodies to minimize exposure during transport. We also have advised them, rather sternly, to try to increase their own morgue capacity to the best of their abilities, because we cannot have all the hospitals rely on the OME's capabilities, which we have expanded, and again, I will mention that. Now, one of the things that we can do is exercise our ability to waive the 48-hour wait time usually required for cremation. So when appropriate, we're ready to expedite the cremation of these bodies, or these or any bodies. Now we have increased, the OME has increased its own body storage capacity to nearly 3 times its usual. And I'll show you a graph in the next slide, but we'll continue on this one for now. We have the ability to hold 136 bodies as of right now. The next item is that I want to share with you is that we're working on fitting one of our autopsy suites with a negative pressure system, which would put us in compliance with CDC recommendations for performing autopsies on cases like this. We currently do not have a negative pressure system, and facilities is working with us. In fact, they're coming up today at 3 to start working on that. So thanks to Mr. Solly and Sam and everyone on that team that has been very diligently working with all of our needs. Now the next point is we have secured testing with the lab upstairs. So far, we've tested 6 decedents. All of them have come up negative, and further, examination and ancillary testing have revealed, non-infectious causes of death. But we're thankful again to Dr. Ocaranza that was very receptive to the needs of postmortem testing, and that's been working rather well. And then additionally, we have identified several county employees that would be able to act as drivers to transport bodies in a safe, competent, ethical, and respectful manner as the crisis continues. Should our current transport service become overwhelmed? So that's one thing that I wanted to just kind of keep in check in case that becomes some sort of bottleneck. And again, I want to acknowledge and recognize my fellow department heads who went back to their staff and their offices and identified these volunteers. And then just a little update on PPE. It's this situation, as we all know, can change dramatically. So it's hard to predict. But right now, we feel that we have enough PPE. We have about 500 body bags at hand that we can use, and with the possibility of getting more through different outlets. Now, on the cases themselves, like I said, we've tested 6. They're all negative. I wanted to share with you now, if you bring up the next slide, the efforts that we made to increase our morgue capacity. So we had these frames that can hold up to 4 bodies at both of our refrigerated rooms in the OME, but a lot of those frames didn't have the actual trays. So our capacity, when this started around mid-March, we really could only hold 46 bodies, and all those trays were pretty much back ordered from our supplier, right? So the first thing that we got is we got a refrigerated trailer from the border rack that is parked outside, ready to go, So that holds 20 bodies. Now, in the next few days, working with Public Works, they managed to manufacture this. I guess they're wooden slabs that would act as trays, and they did it very, expeditiously, I may add. So we got 22 of those, and then in order to further increase our capacity, again, Public Works and the personnel from Road and Bridge manufactured these frames, which again, we couldn't get an order for the next 6 months from our usual provider, but these people that are incredibly handy and just very, again, receptive to our needs, manufactured 12 of these frames that will be, some of them have already been delivered to the office, and these trays include, those wooden slabs. So all that has increased our capacity to up to 136 bodies. And so on the next slide, I really just want to give them a shout out to Norma and Fernie and their team. These guys are just an incredible asset to the county, and they're doing a great service for their community, and they did it expeditiously. And I would have to say, with minor budgetary impact, and they're just extremely reliable, and it's delightful to work with them. That's my update.
Dr. Rascon, I'm sorry, have you completed?
Yes.
Yes, sir.
Yes, Judge, thanks.
Okay. No, thank you. Betsy and I know you're like the hidden gem for the county. And every time you're on, I think people recognize behind the scenes and, the unseen heroes that you have in your team. And thank you for recognizing our county workers who are supporting you to be successful. So yeah, thank you for allowing us to have a better understanding of all the behind the scene initiatives that are involved, and then how you become that that point of for us to feel comfortable about how things are going in the medical examiner's area. So thank you, Dr. Rascon.
Thank you, Judge.
Betsy, Commissioner Pettis.
I think there's a question for Dr. Rascon.
Yeah, Commissioner Pettis is.
I just had a question regarding the negative air pressure. I know it's something we've discussed previous. Do we have a timeline on that?
The timeline that I was offered, it was around last week of April to be finished.
The last week of April?
Yes, sir. We just got all the materials in, and I know that's why they're heading over there today at 3. And Dr. Rascon, we're asking that they be finished out of the autopsy suite by then with their work for the day, so that the team can get in there and start to work.
Okay, thank you.
Yes, sir.
Thank you, Dr. Rascon. Betsy?
Yes, sir. If we can go back to the slide, I believe the next one is the district attorney. I believe there's someone here.
Yes. Good morning, afternoon.
Welcome. Welcome.
Hi, Jaime Esparza, the district attorney. My update, I think, is brief. We still do business. We're still operating. The majority of the work we're doing is jail cases. I let most of the staff go home as early as March 17th, but most of them are working from home with the help of IT and then the IT guys in my office. We have, I think, adjusted remotely pretty well. We handle the daily dockets in the felony courts and in the misdemeanor courts. And really, with the cooperation of everybody involved, I think that is actually going really well. We do the jail mag every day, and that's those magistrations. Those 48-hour hearings seem to be going off well. We handle about 28. We review about 28 to 30 cases a day over at DIMS, and we have been present at all the court hearings that we need to be present at. and we're still working remotely. I think the staff has been doing pretty well. We stay in contact with them daily through either Teams or Zoom, and so far I think it's going pretty well. I'm pretty proud of them. They've stayed active, and we've managed to be able to work remotely throughout this process, and probably continue into the future as necessary. I'd be happy to answer any questions.
Thank you, Mr. Esparza. Thank you for your support. Betsy?
Okay. If there's no questions for Mr. Esparza, the next update we have is from Bill Cox in the Public Defender's Office.
Bill.
Good morning, Judge, Commissioners. Bill Cox, your Interim Chief Public Defender. Like the DA's office, we've been doing remote work since mid-March, and we've gotten a new opportunity late last week with the governor's change in rules dealing with notarizations, that we can now take notarized statements over video, which will help our investigators to do a little more work on cases while still not exposing themselves out in the community. We continue to do increasing numbers of electronic hearings. As of the end of last week, all of the hearings we're participating in are electronic. JPD has started doing their hearings electronically before the recent issues with COVID in detention. And so our attorneys are interviewing clients over the phone before the detention hearings, doing the detention hearings, and then going forward with pre-trials and their dispositions as necessary. I also wanted to give the court an update on the 48-hour hearings at the jail magistrate. As Mr. Esparza said, they've been going very well. Approximately half of the individuals have been getting out on PR bonds. We have been doing all of those by video since they started. And probably the biggest challenge we are working on right now is getting virtual visits in place with clients who are detained at either the downtown jail or the jail annex. And we've been working very closely with the Sheriff's Department, IT, and county administration on that, and are hoping to have a solution in place in the relatively near future. And the other development we wanted to make the court aware of is the courts have expressed an interest to start moving beyond the essential hearings of just bonds or pleas to clients that would either get them out or move their case further toward TDC if that would be the case. Over the weekend, and we're working with the courts to see where we can collaborate with them to be sure that we effectively represent our clients, and at the same time be sure that we are complying with the emergency orders for COVID to keep our clients and our team members safe.
Bill, great job. Any questions for Bill? Betsy?
Okay. Going back, our last update on this slide is from purchasing. Deborah?
Deborah, welcome.
Thank you. Can everybody hear me?
Yes, we can.
Yes, ma'am.
Perfect. I hope my slide is showing up.
It is now. Yes.
Oh, perfect. Perfect. Good morning, everyone. I wanted to give you an update. I've only got one slide, but I've got a lot of information to give out. As you've heard before from the representative from the city, orders are being placed through Border Act. Basically, we're all using the same vendors. In the supply chain, a quick update is that we have had initial receipts in bleach and sanitizer through local fills. Some no-touch thermometers, local fills, not nearly what the sheriff's office needs. We do have all of these items on long-term orders, but there's lead times. Through some of our local partnerships, for instance, just recently, UMC was able to provide us with an order of gloves through their connections. And so we did receive a fair amount of the gloves for the SO and what they might need. We've been getting questions from the ISDs and all of the local agencies that are associated with our purchasing alliance. What we have sourced and on order, but with longer lead times, are the surgical masks, N95 masks, medical face shields, gowns, and cloth masks. For instance, we are expecting an order on all of the medical grade masks, face shields, and gowns on May the 14th. That's a long lead time. Please be aware that we are still trying to source from local firms and from area agencies in order to kind of fill the gap between now and the lead time when those are needed. The cloth masks, Ready One, we're already in contact with them, the same as Borderac. We have a huge order of cloth masks coming in, and I believe those are going to be here on the 20th of this month. We've just coordinated with Sun City Distilleries to get 10 gallons of hand sanitizer. So we are thinking outside the box as well to kind of fill the gaps that are being created by the long lead times. For instance, the no-touch thermometers. Just this morning, right as this meeting started, Gloria at UMC turned us on to a local vendor that may have come into possession of some no-touch thermometers, and so we're on the phone with them. We are coordinating with Wally and Ed at this time in order to make sure that the funding is correct, making sure that departments are aware that they need to go to budget and the county auditor and make sure that they're getting their orders in and that they're being appropriately accounted so that we know what the emergencies are. Of course, disinfectant wipes and sanitizer, super hard to get a hold of. We do have those on order. For instance, even a reliable quick delivery from Amazon has some delay. We've got some masks for Public Works on order from Amazon. They're also due on the 20th. So we've got Public Works out there still needing an order, and we're getting closer to the days those are due. But unfortunately, they're just not here yet. In the interim, I did want to assure everyone that we are not resting on the POs that have been placed. I've got staff that have contacts with local firms. For instance, as the Walgreens and the CVSs get orders in of certain things, we call on a regular basis, and we're trying very hard just to pick up small amounts that we can get out to the departments. The other thing I wanted to say is that our Purchasing Alliance, we created it because we thought we could gain some efficiencies, and we created it. It was created by the city. It was a brainchild of Bruce Collins, who is the director of purchasing for the city. When he put it back together, we all saw the benefits of it. But right now, it's becoming even more important. And if it wasn't created for something like this, I'm not sure what it was created for. We're also in contact with Fort Bliss. We've shared the items we are having trouble sourcing, and Fort Bliss is also sharing those throughout their contacts. Both the city and Fort Bliss have stated that there are the same sourcing issues we're encountering. UMC's been valuable to us. We are partnering with anybody that needs to partner with us. I do anticipate that as some of our larger orders come in, we may be contacted by some of the smaller townships and local ISDs to see if there's any way we can help. And that might be something that Commissioners Court wants to put on their radar just in case, because that will be outside of the purchasing arena at that point. I believe I've given you all the information I have for this update, but I'm happy to take questions.
Thank you, Deborah. Any questions for Deborah?
Deborah, can you unshare your screen, please?
I'm trying. I'm not as good at this as everyone else. How do I do that?
It was down at the bottom.
Stop sharing. Got it.
Thank you.
Okay. If there aren't any questions for purchasing, Miguel, thank you, Deborah. Miguel, Alexis, if you'll advance the slides. We have some additional updates we want to go through, but I would like to go ahead and let Joel, if he's on the line, I believe he is, give an update on where we're at with our partnership on the city on some additional homeless resources.
Okay, good afternoon, Commissioners Court, Joel Bishop with County Administration. We have made a lot of progress on this since last week. much to the thanks of some of you, and many of you have helped with the county. The city has pressed forward on a contract, and they will be moving tomorrow. They will be moving in tomorrow. The county is poised to do the transportation tomorrow. Jose Landeros has been very flexible on that piece of it. And Irene Valenzuela is working with them to, we met with them on Friday to work on our coordinated entry plan. So this is coming together nicely. I know there's been some bumps in the road, but our county attorneys did an excellent job with some legal work and research. They found some contracts executed in Fort Worth that were similar to what's being to what we're trying to do here, and that really helped push it forward with the city and the Opportunity Center. So many thanks to Erica Rosales for her good work on that, and Christina Sanchez and Ryan Kerr. They've just been great. So the primary thing that the county's doing now is helping with coordination, particularly with transportation, and it may come up that the Opportunity Center requests additional assistance with transportation beyond the initial transport that we agreed to. So I will keep the court posted on that, but they expressed to me on Friday they may need some more assistance with transportation needs that come up. So as far as coordinated entry goes, the city has been working with us on providing us with a means to do that for our staff to be able to do virtual interviews. So that will be good so our staff don't have to necessarily be on site. They may need to at the beginning, but perhaps they can avoid that altogether. So we're working on that. The Sheriff's Department has been great about their willingness to be on standby, do some extra rounds, and potentially provide some security assistance if needed. So the overall collaboration is very good. The heavy lifting is with the city right now, trying to organize that Acosta Center on the Delta Recreation Center operations with the Opportunity Center and many other partners that have jumped into this. And did want to thank Commissioner Robinson for jumping in so aggressively last week to assist with this. I know you've done a lot of work and outreach there, Commissioner Robinson. Thank you, and Commissioner Stout and Judge Samaniego, you've been great. Betsy, thank you for all your help with this. This is a massive setup in a very short time, and it really did take a lot of teamwork, and I know you've all put a lot of effort into it. So thank you very much for your help with that. With that, are there any questions on this? And thankfully, by the way, it's my understanding, I spoke with them on Friday, but that there have not been any confirmed positives. I know a few have been isolated. OEM has taken a few from the Opportunity Center and placed them in hotels. As far as I know, to date, there have been no positives there, thankfully. So we're still in a proactive stage of avoidance at this point. Are there any
Joel,
questions for me?
Did you have an opportunity to? We're trying to benchmark with Las Cruces. Looks like they have a very unique setup for the homeless, and I was wondering if you had a chance or did schedule something. I know the mayor was very proud and interested in working together to see there was some collaboration and some sharing of strategies for the homeless.
Yes, thank you, County Judge, for following up with that as well. With a meeting with the mayor of Las Cruces, we had, as I mentioned last week, we had received a few intakes from Las Cruces into our homeless services, and the mayor assured us that their infrastructure is good there in Las Cruces. And after we met with him, County Judge, he reached out to me and he has connected me with the director of that program there. So I'm going to be paying them a site visit. I haven't been out there yet to do that, but I will be visiting with them and make sure that we have collaboration, close collaboration with them on homeless services. And as you mentioned last week, we may be able to gain a lot from each other as far as what we're doing to respond during this time of crisis and homeless collaboration in general.
Yeah, we're so united and so close to each other and so much communication between Las Cruces and ourselves in New Mexico. So thank you for that. I appreciate that. Commissioner Robinson, I know you wanted to make some comments.
Yes, definitely. But first of all, let me just say that Joel Bishop, we need to put him to be an ambassador. He is exercised the utmost in diplomacy. In light of we ran into a couple of glitches last week in regards to with the city, but he maintained his poise. And I made very confident comment that we're not going to let the ball drop, and we did not. The ball did not drop. We had some issues with the contract, but I made a couple phone calls, talked with the deputy city manager, Kerry Weston, and we worked that out. And so contract. And let me also say that our legal department, the county attorney's office, they were very good and very instrumental in making these things or easing the pain in this endeavor. We had also got some good support from the National Guard and Reserve Center, where we got 50 blankets and 50 sleep mats donated through the Opportunity Center, for the Opportunity Center. So there were several people that played, quite a few people, played a very instrumental part in putting this piece together. They're about to, we plan to have to stand up the center today. It looks like it'll be tomorrow they'll stand up. So there are a few logistical things that need to be worked out, but for the most part, they're ready to open up business.
Thank you, Commissioner, and thank you for staying close by. Your background goes way back on this particular matter and homeless and what you've done in the past. So thank you for staying close to this great initiative that should be taking place this week. Thank you.
We'll stay on top of it.
Thank you. Joel?
Any other questions for me?
Okay. Thank you, Joel. Betsy?
Thank you, Joel.
Thank you all.
Thank you. Great job.
Judge, commissioners, okay, going back to our update, I wanted to ask the court if today they would implement and approve a hiring freeze effective immediately. We've had hiring freezes in the past, and we generally have certain exemptions in our hiring freeze. So if anything that was, any positions where an offer has already been made and a person has already accepted, any time where there's a frontline customer service position where collecting revenue is a primary function of the job, those are exempt from a hiring freeze normally. Positions that are statutorily requiring where the whole where only one position exists to perform the function. This is specifically for bailiffs, court coordinators, and court reporters. Positions covered by collective bargaining are exempt from the hiring freeze. Positions 100% funded by special revenue, by grant, or by discretionary funds that cannot be used to offset general fund expenses, and positions filled by internal process which create another county vacancy. Those are generally the positions that the court in the past, that the county in the past has exempted from a hiring freeze. So we would, even with these positions, where possible, we would encourage departments to hold them vacant if at all possible. But we would ask today for the court to support us implementing our hiring freeze policy.
Betsy, is Melissa going to be presenting just to maybe get her views on this as well?
I will tell you, she's provided a plan to me, and this is a portion of the plan. We have other elements of the plan that we have not finished discussing, where I think we have additional elements that need to be implemented. In this particular case, I think we need more options in the plan for potential cuts. So the initial plan she's presented to me, we're meeting on today at 3, but I believe the hiring freeze we can implement immediately.
Commissioners, any comments?
Yes,
questions?
Commissioner Robinson. I would like to see the plan before we make a decision as far as when the effective date. I don't have a problem with saying that we implement a hiring freeze, but what's the plan? I would like to see the plan. If you got a preliminary plan, you're going to finalize the plan. I'd like to see that before we make a decision.
So you want to see the other elements of types of personnel reductions?
Yeah, well,
before you implement any of them.
The types of personnel, but the plan itself. You know, what is the plan?
Okay, well, we can bring that back. It's just it's not completely it's not completed yet. It's not all inclusive yet.
Well, could you say that you have be completed by next week?
I'm meeting with Melissa today. I don't know, today at 3. I don't know if it'll be 100% complete by next Monday, but we can sure work towards that.
Well, I would say that before I make a decision, I would not make a decision without having something in my hand to see what we're talking about. But you'd be closer to having it complete next week than you are today.
Yes, sir.
Betsy, and I think that the commissioner's right. Also, I believe that at this point, I mean, you would look at what's essential and what isn't at this point in time, regardless of the freeze or not, that you would be able within your scope so that we wouldn't have to, you know, that the plan wouldn't allow someone who's not essential at this time to be hired, because I think it just would take some judgment at this point. And then what I would like to see in the plan also is increments of that. What happens if it gets, you know, things worse? What happens if it's going to be longer, that we start getting more of an indication that it's going to take us further out, and sort of increments as to what would happen under different scenarios. And I think the court would be a lot more comfortable seeing the entire plan. But like I said, I think it's still your judgment not to hire people at this time that are not essential to the, you know, to the operation, or not essential to at this point in time, where they can wait. And I don't know if that requires us to give you that kind of opportunity or authority to do such. But I think that would be part of any natural hiring process. Would be, is it essential now? Can it wait? And if it can, we could pick it up later. And then if that position becomes critical, then of course you'd bring it back up. So I think Commissioner Robinson's suggestion, you can answer that for me, Betsy, would not hurt any hiring that we would regret later on, or within the next 3 or 4 months. Would I be correct in saying that, Betsy?
Sure. Yes, sir. And right now, under our current plan, under our current hiring freeze policy that we've used, there is a procedure for departments who either believe that their position is essential, or to request a waiver from the hiring freeze if there is some extenuating circumstances. But we can include this as part of the overall personnel reduction plan that we'll be bringing.
Thank you, Betsy.
I appreciate that.
Betsy, oh, I'm sorry. Hi, this is Christina Sanchez, Assistant County Attorney. Betsy, my question, are we bringing back the plan, or are we bringing back a policy to the court to accept, and maybe some considerations to your chief administrator policy as well?
So this, what we'll be bringing back is a plan that shows all the different ways we can reduce costs for personnel costs.
Okay, all right.
And what would be exempt from that.
Okay, and maybe if the idea is to bring it back on Monday, we post that as an item so that the court can take that as official action, would be my recommendation, so that it's clear for record purposes and also for the employees and the department.
Okay.
Thank you.
Okay.
Thank you,
no
Christina.
problem.
I think we had a question from Commissioner Pettis, or?
Yes, sir.
Thank you.
I mean, also under these circumstances, again, just given how fast, you know, things are moving, and you know, there's lots of, you know, this week I think is going to be a big week, because we're going to get the official job numbers from the Texas Workforce Commission. I also don't want to tie Betsy's hands. You know, I mean, I think it is appropriate for her to bring a policy forward, but as chief administrator, where she's responsible for the management of staff, I think she should be able to at least take some steps as she deems appropriate. We should trust her judgment on what what should be frozen until a policy can be brought forth that we're all on the same page about. But other entities have done the same. Bexar County, the city of El Paso just implemented one as well, and they didn't necessarily require council approval, but I just think Betsy should be given whatever leeway necessary so she can address the problem at hand.
Agree. Thank you, Commissioner.
Judge?
Commissioner Leon?
Yes, I just have one question for Betsy. And I agree with everything that's been said. The only question I have, Betsy, is an offer is made between now and the time you come back with a plan, which from what listening to you could be 2 weeks, maybe even 3 weeks. Is there a danger that a new employee could be offered a position, then we'd be forced to hire? What is your position on that?
So that's why if a position has already been offered and accepted, those positions we would continue with the hiring process, because generally those individuals may have already left other employment. But this would be for any position that's vacant and a position has not been offered, or any position that becomes vacant that doesn't meet a criteria. Okay, but my question is this. Do we have any type of exposure between now and the time you come back with a plan that a future employee is made an offer, or is that, yes,
will
sir.
that be stopped through your office?
Yes, sir. Well, we can absolutely right now take the existing vacancy list and ask that departments not fill vacancies if they have not already made offers, to not extend any offers. There are certain cases where the positions are statutory, where those we would not try to prevent them from proceeding. But in cases where it's a position that is not essential or is not meeting one of the other, generally the criteria of the hiring freeze policy that we'd be bringing back, or as part of this overall plan, those positions we'd ask that departments refrain from making offers.
Okay, thank you.
Betsy, do we have any position where the process, let's say, is 3/4 of the way, you've come to some, a smaller group of people that you're thinking about that's critical with the county? Because there's also the other part of it, is that you have a tremendous candidate and you're right there at that point, and then we sort of truncate the process. So do you have any situations where you're way ahead of the sort of almost there to make the offer? You're not at the point where you've made it, but you've put in a lot of energy and work into a critical position. Do you have any situation like that?
So I cannot speak to every single vacancy we have at the moment. And in the case where we have departments that have whittled it down and gone through a process, and they are down to a few top candidates, there are cases I do know of, but I'm sure I don't know of all of them. And in those cases, those would be on a case-by-case type basis. In our policy, it allows for a department to come forward and ask for a waiver. That would be an example of where you'd say, I have a candidate who is exceptional. It's an exceptional hire. I'd like to request a waiver. And here's the impact of doing so. The thing about doing a hiring freeze, it's generally our first step before we start looking at other types of personnel reductions. So before we start looking at reducing benefits or reducing hours or asking existing employees to take a furlough, we generally are going to look at holding off on increasing our personnel costs by filling vacancies. So that's normally what we would recommend that the court consider first. And so it's kind of our first line of budget control to minimize the impact to our current employees.
Great strategy. Thank you.
Okay, so going forward,
at this
we'll bring back.
We agreed that we would wait till next week to have a more complete understanding. Is that the favor of the court?
Yes.
Okay, thank you,
position, Judge.
Betsy. Thank you, Commissioner Robinson. Betsy?
Okay, and then the next thing I wanted to mention is we do have events in park events, both pavilion rentals and park rentals. And under park rentals, I need to expand on that. We also have sports park reservations in May. This is all for the month of May. We have pavilion rentals, 3 pavilion rentals. We have free walks booked. We have multiple golf tournaments and multiple sports park tournaments that are currently booked for the month of May. I would like to, as early as possible, know whether the court would be willing to either call those off and say we're not going to have any of these types of events during the month of May, or know whether the court would like to delay it. We're just 2.5 weeks out from the beginning of the month of May, and would like to get some direction from the court on this.
Christina, are you on?
Yes, sir, I'm on.
Yeah, I was going to ask, is there a possibility we could follow pretty much the Coliseum? And Brian Kennedy has done a lot of work in understanding the contractual agreements and what needs to happen. And the approach that he's taken is that he's protected under the order of not being sued because of cancellation. So he's actually taking it almost to the point where it's a week away or 2 weeks away, and then he lets them know that the possibility is very slim, but he's not jumping too far ahead in case, and I know this is optimistic, but in case that the order was dropped, that he wouldn't be in a situation where he would lose some of the revenue, or that he'd be in a contractual disagreement. Could we follow something similar like that with the county?
Sure, Judge, and I'd have to go back and see what those agreements are and what they provide for. I believe members of the county attorney's office in our public works division were already looking at that, and I think communicating that with Veronica Myers as well as Ms. Palacio. So we'll need to look at that. There's no, I guess, immediate harm of doing that. However, I think as a courtesy, and I'm sure they're already keeping a pulse out there, it would be my recommendation that there be some communication with those individuals who do have events, to let them know, and quite frankly also to see what they want to do and maybe get their input to say, does it make sense for you to not move forward with some of those plans right now? And so if those haven't already been done, and I'm sure those communications have taken place, but it also gives them that opportunity to start thinking through those issues. But we certainly can do that, but it's also ensuring that this is not a sure and done deal if we are looking at an extension of these orders through the month of May.
Well,
but the order would
thank you for that insight. And I think I know how Veronica works, and I think she will be in touch with them. And I think at a certain point, maybe they themselves might want their money back, or their refund on their whatever amount of money they put up ahead of time on their own, which obviously would be a much more generous way to handle this with a lot of courtesy. And I guess that would be, I don't know what the commissioners, how are you feeling? I know May does not seem likely that would happen, so maybe we could step ahead and say, May for sure. Doesn't make sense to make any commitment, and then we go sort of month by month moving forward.
Judge, we would bring these back every few weeks. We would come back for an update for the following month.
Okay. So what do we need here, Christina, to?
For staff, we just need direction whether or not, because of course, we're a community that doesn't have an exact date on our order to either make a decision to re-extend or to end. So ours is just an ongoing order. We're trying to get an idea whether or not you're okay with going ahead and notifying everybody in May that we will not have our facilities, we won't host any of these events at our facilities for the month of May.
Yeah, I think we should cancel. I think we should cancel anything in May, and then I agree with what you said, Judge.
Yeah, then May look at June kind of thing. So,
yes.
Yeah, I agree, Betsy. I think that's the best thing. And, give them an opportunity to know this is not going to happen. A lot of events are very special and they need to know maybe they could postpone them further out. But I agree, Commissioner, as well, that May does not, I don't think we'll hold any, we have no worries that, that May will be cleared up at this point in time.
Okay, so we will proceed with canceling any events in May, and we will definitely communicate with the organizers of these events. And then
Thank you
also
so
we
much.
have coming up community cleanup scheduled, both later this month and in the month of May. This is where we allow residents to bring and unload, and our staff also help unload their trash, garbage, different types of materials, tires, things of that nature. We wanted to check to see with the court whether they wanted us to continue to host those during this time. We do often have several vehicles lined up at the same time and have several individuals throwing refuse into our containers during these events.
Well, if you look at the spirit of the order, we call it attractive nuisance. We don't want anything that we create a situation or environment that you might have a problem with, like people gathering together or getting off their vehicles. And so it will be more a decision from Public Works to say, how critical is this and what would happen if we waited. But we're discouraging any kind of initiative. That's why we went into the parks, and because it creates that environment. And so you would have to make that decision that you would create an environment. Can we handle it? Is it essential that we're doing this? Can it wait? And maybe I'd like to hear a little bit from them as to whether or not they feel that they can handle such a situation. If what I'm seeing and what I've seen from other counties, anything that can wait till September or go forward, we should take advantage of that.
And that's exactly what we'd request, Judge. We request to be able to reschedule these a little bit later in the year, and we would re-coordinate so that there's still an opportunity for the public to come get rid of this additional waste, but minimize the contact at this time.
Mm-hmm. Commissioners?
I agree with that.
I agree also, Judge. I think we just need to coordinate with the other parties, the nonprofits and the other communities, as far as to include the city as far as the environmental services.
Exactly. Commissioner, I think you're
muted, Commissioner.
Yeah, I was just saying, no, I mean, you're exactly right, Judge. I mean, the spirit of the order is to minimize social contact with folks and minimize how often they go out. So it would seem more appropriate to postpone these for a later date.
Okay. Betsy, we have a consensus on that.
Yes, sir. Okay, perfect. Thank you.
Thank you, Betsy.
Okay. No, thank you, sir. The next item we have an update on. First of all, I want to thank each member of the court on late last week, we reached out about the CARES Act and a concern with the way that CARES Act was being interpreted that made it look like we were one of a handful of counties around the country that might not qualify for CARES Act funding. Your quick actions, several of you all reached out. I heard that many of you all had contacted various members of our federal delegation. And as we partner with the city and other local entities, our need for this funding reimbursement is only going to grow. And we're still waiting for Treasury rulemaking that might address this. I did just receive an update while we were in the meeting, and just in the last 20 minutes, that the latest conversation with the Treasury Department is they are going to allow both the county and the city where there's a population of a city with 500,000 or more, and a county that doesn't hit the $500,000 separately, that they are going to accept applications from both the city and the county for funding. As you know, as we're going through this, we're partnering with the city to help fund a lot of these initiatives. Both the city and the county have expenses that will be helpful to recovery if we can both be reimbursed, so we can continue to address these concerns for our community. So it sounds like right now the Treasury Department is saying we will be eligible to apply. Wally and Erica from our grants team are staying on top of that, watching for the funding and any processes that we need to undertake to be sure to get our application in for reimbursement. So that's just an update on the CARES Act. But huge thanks to all of you for quickly responding to that. And also a huge thanks to my team, who had to pick up some things for me late last week on Thursday so that I could be involved in all the calls on the CARES Act and following up on this information.
Betsy, great job on that initiative and getting us quickly to understand how we could support, but thank you for coordinating that.
And also on that same note, Daniel Collins, Government Affairs, last week was his first week as well. He quickly prepared the key important points for us and was really a great resource to us in helping cover that issue as it came up. The next item we have, and again, this goes back to our partnership with the city, who I can't say enough how over the last year we've grown our partnership. And one of the issues that we want to partner with now is on daycare funding. You mentioned, Commissioner Pettis, that Jacob had mentioned childcare is really a challenge for some of the healthcare providers and also for many city and county employees and others who are still having to continue to provide services during this time and need childcare. So one of the things we'd like to partner with on the city and we'd like to bring back to the court an actual agreement is an agreement between the city, the county, and Borderplex Workforce Solutions with Layla at Workforce, is to both the city and the county use $50,000 of funding to create a $100,000 funding pool for daycare to help bridge the gap until Workforce Solutions is able to get some state funding. We're getting all the data together on the number of people that are in need of this daycare assistance during this time, but we would bring back an agreement with full details if the court is interested in pursuing this option.
Betsy, have you made contact with Sylvia from YWCA? I mean, she's been really looking for funding and talked about child care, and so I'm not sure if we could partner or where we're missing out on that partnership, or but I know she texts me a lot on things that she's doing for veterans, for child care, all of these other areas. So I don't know, do we have any communication with Dr. Acosta?
I have not communicated directly with her. We've been communicating through Workforce Solutions, who would actually manage the fund and work with groups like YWCA to provide the health care in the areas where the individuals, I'm sorry, the daycare, where the individuals would need it.
Okay. Yeah, if you could check in with her, I think it'd be a very positive relationship.
Yes, sir. I can get exact details of who Workforce Solutions is working with. I think it's multiple providers.
Yeah, YWCA, and from my previous experience with Workforce Solutions, have a great partnership, and they take quite a big chunk of the initiatives for childcare. But so they might already be handling that. But just sort of find out either through Leila Melendez or through Sylvia if there's any opportunities for a better partnership or relationship with them.
Yes, sir. And I know some of the other providers have mentioned that daycare providers were mentioning that they were having to actually lay off workers. So the actual provider information we will bring back as well.
Okay, thank you, Betsy.
Thank you. On a side note, this isn't on my slide, but we're also evaluating options for our own employees who I worked with both the hospital district a little bit on this last week. Commissioner Stout, you are aware that some of the hotel chains are providing either free or discounted rooms to healthcare providers and first responders during this time who are concerned about being possibly exposed, but then going home to their families. And so we're continuing to work with and evaluate what options are available for our own employees, and we'll be distributing that information as soon as we know. I also want to commend our nutrition program, who continues providing thousands of prepackaged, shelf-stable meals for over 1,300 seniors in partnership with the City of El Paso and several other partners who helped with PPE needs for those distributing the meals. That was a massive operation this week, and it will be continuing as well. And then I think Joel and Commissioner Robinson already mentioned the partnership with the city, and then all the work that went into making this homeless option available, where we'll have this additional facility available to help spread and provide more distancing in our shelters. And that really was such a huge team undertaking, and cannot emphasize enough the appreciation to Joel and our legal team and Carrie and Nicole at the city. Also, El Pasoans Fighting Hunger has identified significant equipment needs, including forklifts, generators, semis, and trailers. We need to see what alternatives have been considered for the short term, but there may be a request to the city and the county to consider how else we could help support El Pasoans Fighting Hunger. They're looking for different sources for food allocations. So this is just a really, the demand has been significant, as you can imagine, with the unemployment claims. I think I shared with you all that unemployment claims had increased significantly over the last few weeks. So that may be something else we'll be bringing forward. We also did follow up from one item last week. Commissioner Robinson had expressed environmental concerns about overflowing receptacles for refuse, and we made the city aware of that. They had not received any of those types of complaints, but they were following up on that. And then also, while I know our law enforcement, including constables and sheriffs, did work to educate and warn the public on gatherings this weekend, I did notice a lot of adherence in neighborhoods where I went out for a walk and a bike ride, and I noticed it seemed like there was it was a much quieter atmosphere than I had been seeing. And then I want to thank our county workforce for all they're doing, the public defender, all of public works, ITD, CJC, our courts, sheriffs, DA, medical examiners, constables, and so many others. I also want to give a special shout out to the county clerk and the district clerk staff who do the work to create and maintain vital public records and who support the judicial system. They often go under-recognized and serve such a critical role in preserving history and documentation to our operations and support. So that's our summary for today. If there's any questions, I'd be happy to answer them.
Betsy, great job. A lot of coordination, and thank you. I think the county is really doing a great job in showing their support and trying to have these partnerships and strengthening some of the partnerships we already had. So thank you for all that work.
It's our pleasure, sir. Thank you.
Thank you.
Judge, before we Before we get off this item, I just wanted to bring up one more issue for consideration, and that has to do with sign language interpretation. I don't know if you all received a letter from a number of organizations in the community that service disabled folks as well as advocate on their behalf, and they sent out an open letter to a number of us, and I got the letter in my email. I don't know if you all did as well, but requesting that we do our best to provide ASL, American Sign Language interpretation, kind of like the city does during their meetings, because there is important information that we're putting out there that a lot of the folks in the hard of hearing community may not be able to have access to, or either interpretation as well as closed captioning is another recommendation that they made, and so I just wanted to bring that up to the court and see if there's something that we may be able to do in that realm. I think it's very important, especially in this day and age when we're trying to put out information, and if we have a group of folks, especially some of those most vulnerable folks that don't have access to that information, I think it's an issue.
Great observation, Commissioner. I'm wondering if maybe you or your staff could follow up on that one in particular, and then just sort of bring it up to, who do we need to get, maybe some more details and take a little bit of the load off of Betsy on all these items. But if you're okay with that, if you could sort of bring us up to speed on what do we need to do, I think it's a great observation.
Yeah, I mean, basically what we need to do is either look for a way that we can provide closed captioning. I don't know, through our technology, our IT team, or I'll also hire an interpreter that can basically do the signing as we're having our meetings, just exactly as you see at the city council meetings. So I don't know if that's something that I can do, but I can work with them and our staff to try and find the best way possible to provide in the future.
That'd be excellent. We've had them at all of our press conferences when we're able to be on site, and it didn't occur to me. So thank you for that observation. So Betsy, I don't know, maybe you could support that as well, but I know Commissioner might be able to lead that forward and get this done ASAP. Hopefully our goal would be next Monday.
Let me, what we might be able to do quickly is we may be able to partner with the city about their ASL providers. And we may also, let me work with Chris on the closed captioning.
Thank you.
Excellent.
Also check with the Council of Judges, see if they, have various translators on staff that might be on contract or ready to go.
That's a great idea. Okay, thank you, Betsy. You'll sort of get the support from the commissioner, but if you could lead that initiative.
And my staff will reach out. Thank you.
So, thank you.
Judge.
Commissioner Robinson? Commissioner Robinson?
I just want to make a comment in that regard. That's a personnel issue, and that Betsy should be handling that. I personally will refrain from getting involved in any personnel issues.
Yeah, I was thinking more, Commissioner, of sort of the coordination of what's out there kind of thing, or how how the city's doing it, and then passing that on to Betsy, or actually to Melissa as well. So, but a comment well taken, Commissioner.
But that's a personnel issue. Betsy and HR should be handling that.
Okay. Thank you, Commissioner.
Item number 8, purchasing. Approve the purchase of Cisco SmartNet maintenance and support for network equipment countywide through the Information Technology Department using Texas DIR contract DIR TSO 4167, awarded to Pivot Technology Services Corporation of El Paso, Texas, in the amount of $286,741.34. Purchasing approved on April 7, 2020. Funding is available in general funds, ITD, maintenance, repair, hardware.
Good afternoon, Commissioners, County Judge. Deborah Carrejo-Troll, County Purchasing Agent. This is for routine contracting for IT SmartNet. And basically this, if approved, you're going to allow them to contract to maintain the availability, reliability, and stability of the network for county locations, as well as the security. And we're simply requesting use of the Department of Information Resources contract to match the dates listed in the documentation.
Motion to approve.
Second.
Commissioner Perez,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Commissioner Robinson,
Aye.
Judge Samaniego.
Aye.
Motion carries.
Thank you.
Item number 9, economic development. Discuss and take appropriate action to provide economic development staff with direction on the use of remaining funds allocated for the County Healthy Food Financing Initiative. Funding is available in general funds, economic impact, healthy food.
Good afternoon, Judge and Commissioners. I think Valerie Venecia, this is Andrea Hutchins with Economic Development Department. I hope everybody is well. Valerie Venecia is supposed to be on the call as well, but I'm not seeing her beautiful smiling face. So,
Lucy Gabriela there.
Valerie, are you on?
Yes, I'm here.
Okay. Okay.
You guys hear me? So good afternoon, Judge and Commissioners. It's great to be with you this afternoon. I'm going to kick off our presentation on the Healthy Food Financing Initiative. Just to give you a brief update on the 3 projects that were awarded back in February. And after I provide that brief update on projects, I'm going to be turning the presentation over to Dr. Leah Wiggum and Ms. Gabriela Gallegos, who are going to give an update in general as to UT Health and all things HFFI in the greater spectrum. And then Andrea will be closing the presentation with recommendations for how we might consider using the funds that are remaining in our Economic Impact Fund at this point. So if we can go ahead and switch over to the presentation and moving into the second slide, Miguel, please.
Please stand by. We're pulling up the presentation.
Thank you. There we go. Okay, so as you know, back in 2018, the county opted to allocate $500,000 in support of grant funding for the Healthy Food Financing Initiative. And as of March, per votes that were taken in February, the auditors have dispersed $231,980 to 3 awardees. And we learned in April of this year that an additional $100,000 was awarded to the El Pasoans Fighting Hunger Food Bank. Currently, there are just over $148,000 remaining. At this time, we'll go ahead and skip to the next slide and begin going over the 3 individual projects that were awarded and funds were dispersed in March. So we had $150,000 that were issued to Desert Food Hub for expansion of their delivery program of local produce, and also to develop a large-scale processing center in central Paso, where local growers would have access to large-scale equipment for sanitizing and preparing for consumer sales. And they also had plans to open a miniature grocery store directly in front of that processing food hub. And then just over $63,000 were awarded to Growing with Sarah Farm in Socorro. and they are going to be renovating their existing Adobe property with a refrigeration unit and a mini processing center for growers in that area. And then $18,613 were awarded to Extreme Core Fitness in Horizon City as a means of enabling them to purchase additional equipment for the expansion of their healthy food meal processing and delivery program. If we could move to the next slide, please. So currently, UT Health Center, which you are probably familiar with as the Institute for Healthy Living, they have met with each of the recipients to go over current project status and plans, and also any revisions that have taken place due to shifting gears to make adjustments for COVID-19 issues, and then to go over their timelines and initial steps, and as well as a collection of historical data, any food sales, if they were already addressing retail and food access, the zip codes of the customers that they've served in the past, the types of products that they offered, and as well as documentation of the layouts of their sites before the grant was awarded so that we can accurately measure that going forward. Next slide, please. So Desert Spoon Food Hub immediately noticed a huge increase in their box subscriptions as a result of the COVID-19 outbreak, which is understandable. A lot of folks don't want to go into the grocery store and are relying on having food delivered directly to their households. This has resulted in increases in the zip code that they serve in the northeast of El Paso and far west side of El Paso. And as a means of also adjusting, they've added on fruit boxes and dry goods to their options for folks to order for their deliveries. So they're currently under construction of their cold storage unit and their sanitizing facilities, including the walk-in cooler. And this is at their location on Yandell Street in Central El Paso. They're also in the works of purchasing their refrigerated van to meet the demand for those additional deliveries, which is to include a compressor as part of the customized build out of their van to accommodate the needs. And they've also placed the mini market on hold to adjust shifting gears towards meeting the demands of their box subscriptions. Next slide, please. Growing with Sarah Farm, as I mentioned, their building is considered historic, being that it's an old 1800s adobe structure, and it is located just about a half a mile away from the Socorro mission. So currently they've submitted their application to the Historic Landmark Commission for a certificate of appropriateness for the reconstruction of the refrigerated unit and the farmers market stand. They're also working with the City of Socorro's zoning department to establish, they do have agricultural zoning for the farm plot that's located directly behind the adobe structures, but they'll also need to rezone their property from residential to commercial as a means of accommodating and receiving the general public for sales. They're also working on their applications to the state so that they can accept food stamps via SNAP and WIC benefits. And they're refining their blueprints for the construction of the farmers market stand and the refrigeration unit. And they've also been researching the different types of point of sale systems, since they'll need to be able to accept all forms of payment once they're ready to open up. Next slide, please. And then lastly, we have Extreme Core Fitness in Horizon City. In spite of the gym closing down, the subscription program for healthy prepared foods has expanded, which is really great. So the business owner was able to hire her new staff and purchase her equipment with the help of our grant to accommodate the expansion of demand for her healthy meal prep services. She'll be working with Gabriela to refine her marketing and outreach plan as a result of these changes. and is also refining her delivery schedules. Next slide, please. So it's important to stress that of the 2 of the 3 awardees that are currently open and receiving sales have had to shift gears a little bit because of the COVID-19 crisis. I mentioned that that both of them have seen a pretty substantial increase in subscriptions for both the farm box of produce and also for the healthy meals that are prepared and ready to eat. So UT Health will be working to outline what the long-term implications, and it is important to stress the importance of the role that HFFI will play going forward in making sure that access to food continues in these vulnerable populations. Next slide, please. So at this time, I'm going to go ahead and turn the presentation over to Dr. Wiggum to provide a general overview of UT Health now that it's been established here in El Paso and all of the great plans that they have for HFFI going forward in the expansion of services.
Great, thank you very much, Valerie. Hi everyone, my name is Leah Wiggum. I'm the director of the Center for Community Health Impact, which was formerly known as the Institute for Healthy Living, or the IHL. This project started under my leadership in 2015, this overall project that I'm going to give just a brief history of and give you some updates about some future visions we have. The project was funded by a grant from the Paso del Norte Health Foundation. This grant was to support work that we led in healthy eating and active living throughout this region. And it included an objective to identify the needs regarding hunger, food access, and food availability across the region so that strategies could be developed and deployed for improving food access. Close to $500,000 in funding from that grant has been dedicated to address this objective to date. To accomplish this objective, we first completed a needs assessment followed by a food summit to convene regional stakeholders. That food summit happened in January of 2017. Those stakeholders included members of El Paso County government. And that food summit resulted in the Food for Every Child report. This is the orange covered report that you have all received a copy of, or if you haven't seen it or you don't recall having seen it, we're happy to share a link with you so you can access that report. In this report, the priorities that were identified by the stakeholders included increasing participation in the SNAP program, developing partnerships with food retailers to conduct nutrition education, health screenings, and SNAP outreach at grocery stores in high-need areas, and increasing access to healthy and local foods through the development of a healthy food financing initiative that could provide grants and loans to grocers in underserved communities. So as you all know, the County of El Paso stepped up as the leader in establishing a healthy food financing initiative. While others in the region have expressed interest in HFFI, for example, the City of El Paso, the City of Las Cruces, and Doña Ana County, El Paso County is the first to establish the funding and develop and launch a program for HFFI. Not just the first in this region, but the first in the nation, the first time that a county government has established HFFI nationwide. Our team at the Center for Community Health Impact, or CCHI, continues to partner with the county as the food access partner, providing expertise in nutrition, food insecurity, and program evaluation. In parallel to partnering with the county to develop the HFFI program, our team has also been developing regional coalitions to support the other priorities that were identified by stakeholders at that regional food summit, including the In-Store Coalition, which includes organizations who partner with local grocery stores and other food retail outlets to deliver nutrition education, health screenings, and SNAP and WIC enrollment in the grocery stores. Our intent in developing these efforts in parallel to establishing the HFFI program in the region was so that the in-store programs could be delivered on site at all of the appropriate HFFI grant recipient locations, providing additional value-added services for the customers of those businesses. So now we're at a very exciting point where we have the opportunity to leverage all of these great partnerships and the initial programs and coalitions that have been developed and create some economies of scale to expand these efforts and strengthen our food system and our overall local economy to ensure a long-term sustainable environment that supports healthy, affordable food for the people of our region. And the sustainable part is so important because this is built into economic development. This is helping to support businesses that can sustain a model to provide healthy, affordable food to people in our region. This overall approach will change our region for the long term with regards to access to healthy and affordable food. So our team is now planning to establish a healthy food financing initiative coordinating center. And we do have a slide that outlines this if the slides are available. Gabriela Gallegos from our center will describe it in more detail in just a moment, but the vision for creating this coordinating center is to have a team with expertise that will allow us to expand the efforts that I've just described, creating economies of scale and leveraging existing established programs to bring in additional funding. You can go to the next slide, please. We have initially identified a funding mechanism through the U.S. Department of Agriculture, and we will continue to seek additional funding opportunities to support this coordinating center as well. This initial funding opportunity will allow us to leverage funds that are already committed to this work in the region to secure additional federal funds to support the ongoing work as well as expand this work. So the nature of this particular funding opportunity is that we can at least triple our regionally committed funds with federal dollars. For example, planning underway now indicates that this coordinating center can secure commitments from and establish partnerships with other public and private entities in the region to fund, as one example, staff for additional SNAP enrollment support to extend our in-store coalition work so that we can reach more people at more food retail businesses in the region, as well as set up another HFFI program in southern New Mexico to support additional food system infrastructure in southern New Mexico, which will expand the regional market for our local farmers. The center will also be able to house staff with expertise in areas like marketing to support HFFI grant recipients, program implementation and evaluation to monitor progress and impact of HFFI funded projects, and outreach to ensure development of strong applications for future cycles of HFFI grants. Because this center will be established through the UT Health Science Center School of Public Health, where the Center for Community Health Impact is located, we will have access to the latest cutting-edge research and faculty with relevant expertise to ensure this work is being informed by the best science, and that the results are being disseminated statewide and beyond, bringing recognition and potential for additional funding to our region. In fact, we've already received requests for assistance from places like Harris County and the City of Austin, as well as from groups in California and Ohio. So now I'm going to turn this over to Gabriela Gallegos to tell you in a little more detail what the coordinating center will do.
Thanks, Leah. So I'm just going to give a brief overview of what we are talking about with an HFFI coordinating center and really kind of taking the county's vision for a healthy food financing initiative to the next level. And I kind of just want to step back for a second and point out the two elements that I think have become increasingly important as we've been dealing with the COVID-19 crisis. And that is the need for access to healthy and affordable food and the role that that plays in our community's health. As we've looked at the sorts of pre-existing conditions that play a role in making you more susceptible to a disease like this, obesity, diabetes, heart disease, all of those come into play. And all of those are diet-related diseases that we're hoping will, through a multi-pronged approach, make a dent for the long-term future. The other piece of that is economic development and sustainability of our local businesses and the businesses that serve our local residents. So by investing in those sorts of businesses and organizations that hopefully can sustain this and can offer long-term sustainability and long-term growth, we're contributing both to the health of our community long-term and to the economic well-being of our community long-term. So HFFI really hits at both of these from a critical standpoint at the long-term vision level. So I think as I've been meeting with the 3 recipients, they have all commented on the importance of the timing of this and how it has been fantastic for them to be able to pivot quickly and have the county's support to increase their operations and really make it something that is important right now and able to be sustained in the future. So great timing, and all of those projects are moving forward really, really quickly. So if I could go to the first slide, what we're looking at with an HFI coordinating center, and it's the next one from this, is to take this long-term vision and really have the sustainable infrastructure to be able to continue this work. So in expanding this partnership, it's looking to other municipalities and entities in the region to contribute HFI funds, whether that means grants and loans, or whether that means other sorts of technical expertise that they can offer so that we can really shore up what we can give to these businesses and organizations to prepare them for the long term. Some other communities use public funds as well as private funds. So if that's foundation monies that come into this community, we want to be able to leverage what El Paso County has done to bring in more money that is going to go to businesses and organizations to sustain healthy and affordable food enterprises. It'll also optimize the management of these multiple HFI programs through a single center. So not only through the development of the policies and programs with different municipalities, but really reaching out to different communities in need. For example, if we were to be able to engage the city of San Elizario or the town of Anthony, and they may have specific funding that are available for the businesses and organizations in their communities, we would be able to make sure that those funds stay in their community and that the El Paso County funds are also dedicated to those areas that would make the most sense. So whether that is bundling multiple opportunities or really, just leveraging what they can do with other money that's coming in from foundations and federal or other municipality dollars, we want to be able to do that and really boost what is available for each organization and business that meets these criteria. The El Paso County program, of course, is the cornerstone and the ultimate funder of this, so that will remain the cornerstone of all of that. Next is to coordinate programs through multiple entities. So, for example, if there are those targeted funds that may be available for a particular municipality, that we make sure that those are going to those areas that need them. Non-targeted funds, for example, Dr. Wiggum mentioned the possibility of perhaps engaging more people for SNAP enrollment. We have a significant SNAP gap in El Paso. And so by being able to engage people who will do SNAP enrollment in our community and reach out to different communities that maybe have low participation in SNAP, will hopefully increase the dollars that our residents who are low income have to spend on food. And so it's kind of all part of this ecosystem to develop not only the businesses and the organizations that might provide food retail and food retail infrastructure, but also offer things like health screenings, SNAP and WIC enrollment, and other supportive programs. So we'd like to be able to coordinate all of those through this HFI Coordinating Center.
Somebody has their mic open.
The County of Paso Economic Development Office has required a lot from beginning to end. So from application process management, which includes the development of the application, review of that, going back and forth with our community development financing institute partner to make sure
we didn't hear the last bit of your, probably the last 40 seconds of what you were saying. I think there was like an airplane flying over or something like that. I don't know if you all had the same issue.
Yeah, we have the same issue. Gabriel, just step back a little bit, maybe maybe a minute that I could not hear.
Okay, could we go to the previous slide, please? There we go. I think the last piece of what I was describing was the opportunity for our HFI Coordinating Center to also be able to coordinate programs that are supportive of the Healthy Food Financing Initiative. So this includes perhaps engaging additional folks who can help with SNAP and WIC enrollment, We have a number of community partners that already do this, but as you can imagine, they are short-staffed, and that's a priority to make sure that those residents who are in need are able to access SNAP, which is formerly food stamps, and really have more purchasing power in their pockets to be able to spend on healthy and affordable food. So all of these different levels, we are hoping to be able to coordinate more effectively and hopefully engage the right partners to really expand this and be able to not only efficiently administer the Healthy Food Financing Initiative to issue grants and loans to our business and organization partners, but also to help residents with things like SNAP and WIC enrollment at different sites that are being supported by Healthy Food Financing Initiative as well. So, okay, now on to the next slide. Hopefully that covered it. So what we're hoping to do with this Healthy Food Financing Initiative Coordinating Center is really augment and boost the work that we have been doing in coordination with the county's Economic Development Department. So our role as the food access partner has really been from soup to nuts, working with applicants and project development, as well as outreach. So the application process management has included everything from designing that process, and now we're refining it now that we've had our first round at it. Developing and receiving applications. So initially we would spend time meeting with each applicant to make sure that they understood the program and then could help advise them on what will make their project more effective from a food access standpoint, more sustainable from an economic viability standpoint, and then also just most impactful. So all of that has been part of this. We've also been meeting with folks who are interested but have not yet put together a project. So all of that project cultivation is something that we would like to further develop, and we'll be able to do that through something like the center. Project development and outreach is kind of what I just touched on. So as you all know, in some of the areas that you represent, there are pockets of need that may not be viable for a full business, but perhaps a mobile market would be appropriate. So in order to develop those sorts of projects, we need to kind of meet with different folks and see who has that capability and identify what is going to be the most effective at doing those sorts of HFFI projects. If we could go to the next one. And the other two areas are supporting the projects and organizations. So we currently work with one community development financing institution, and that partnership can absolutely grow and maybe engage additional CDFIs. In other communities, they have broken them up so that they are, by large grants and by small grants. They might be by area of town. There's a lot of different ways to do this, but by bringing in more community development finance institutions and more funding partners, we'll be able to offer more of these grants and loans to the businesses that are applying for them. We did fund 3. We had more than 3 applications, and there are more that are waiting. So we do know that there's high need for Healthy Food Financing Initiative dollars, and this is really making sure that we can continue to grow those dollars and use what the county has allocated as a starting point that we can really, really keep growing to pour more money into businesses and organizations in the El Paso area. And then the last is monitoring, evaluation, and the impact assessment. You saw a small amount of what we've started working with our current funded projects, which is finding out what sort of information they kept. We want to see that what they are being funded to do is being done effectively, being done in a way that is going to be sustainable for the long term, and being done in a way that is going to truly impact the residents in those areas. So by collecting information like clients served, acceptance of SNAP and WIC as payment, figuring out where delivery is possible and where it is growing to. All of these different areas are the beginning of the monitoring, and the longer term evaluation will have kind of a little bit more meat to it in terms of what we're going to be measuring to see how this will impact food access. Because again, the 2 overarching goals of the Healthy Food Financing Initiative are really to look at the long-term food access as it relates to the health of our community, and also to make sure that our businesses and organizations have this infusion so that they can really get that jump start and be sustainable, offering food retail and food retail infrastructure that our area needs. So that was kind of just a brief overview. We wanted to kind of show you what we have been working on, because the since the beginning of working with the county on the Healthy Food Financing Initiative, we've been looking at the long-term sustainability of a HFFI to make sure that it is not a one-time grant and loan program, but something that we can continue to grow, that we can use to leverage other federal and municipality dollars as well as private dollars, so that it is really kind of the anchor for additional funding that will come into this community. So this is one opportunity such as that, where there's the possibility of a kind of a larger vision center that will contribute to the long-term viability of HFFI and the continued growth for that program. So I'll let Dr. Wiggum kind of explain to the opportunity that we're discussing.
Thanks, Gabriella. So as I mentioned earlier, we have identified this. It's a brand new funding opportunity through the USDA, and it's entitled the Regional Food System Partnerships Program. And it's very exciting because when you read the description for the funding opportunity, the partnerships that we've established here in this region are exactly what they're looking for. And so I think this is going to be a really innovative proposal where we can demonstrate all the progress that we've made over the last 5 years or so that we've been pushing on identifying strategies to address food access and hunger in our region. And this has been part of the long-term strategic planning that I've been engaged in, knowing that, as I mentioned earlier, we've had almost $500,000 funding from the Paso del Norte Health Foundation to get us to this point. And that includes existing funding that will go through a little less than a year from now. So through March of 2021, we have funding in place to do the work that we've been doing and to continue operating as the food access partner for the county HFFI program. However, at that time, I don't expect that money to extend. And so that's why, as part of this long-term planning, we have been working to identify funding opportunities. And this idea to create a coordinating center really helps us bring in funding opportunities from different sites, such as this USDA grant, and leverage all of those partnerships under one coordinating center. So I just wanted to make it clear that this is part of our long-term vision to identify additional funding opportunities so that we can keep providing this kind of support, not just to the El Paso County HFFI program, but to kind of keep tying together all these different partnerships under one umbrella organization that can keep this work moving forward. And I will turn it over to Andrea now.
Thank you, Dr. Wiggum. And I just want to also say, publicly, thank you both for all of the hard work that you all do behind the scenes. I know that this has been an effort that's been ongoing between the two of you and, various other partners and our own staff with Valerie and whatnot. And just, there's hundreds and hundreds of hours that goes into this type of effort that people don't see. So I think that overview that Valerie gave at the beginning, where we could see the resulting fruits of everyone's labor, is encouraging. So if we could have the presentation back up, please. Next slide, please. So we wanted to bring to the court today just a few options as far as, at the beginning of the presentation, I know that you probably noticed that there is $148,000 remaining in this year's budget. And so we wanted to bring you all a few options that you all could take moving forward with this $148,000. So the first option would be reopening the application cycle for a kind of like a mini program funding cycle. The second option would be to utilize those funds to provide the matching funds to UT Health. That would be the 25% that was mentioned earlier, where we could really make some long-term dents in providing funding, and then also ensuring that our partnership we're able to continue with UT Health after the Paso del Norte Foundation grant expires in March of 2021. And then another option, and hopefully an option that we could use either way, would be an HFFI branding and marketing package. Next slide, please. So if we were to reopen the application cycle, this application cycle would reopen. It would be a relatively short window. It would be May 1st through the 30th, and we would provide up to $148,000 for small businesses and local entrepreneurs. Next slide. Option 2, and please forgive the fact that this says 20% matching, it should be 25% matching to UT Health in support of their HFFI coordinating center. And do keep in mind that this would unlock potentially 3 times whatever the funding amount, up to 4 times the funding amount is that we decided to provide to them in return for grant funding. Next slide, please. And then option 3, so this would be a much smaller piece of what I'm hoping that you all would consider adding to either option 1 or 2. We're looking to solicit a small local marketing firm to create a logo, website, and printed materials so that no matter what it is that we end up doing with HFFI materials or funding in the future, we're able to kind of brand that, if you will, as El Paso County HFFI program. Think, if you will, when you go into a business that has either a Better Business logo or like a local Chamber of Commerce logo that kind of implies that that particular project has been funded by either Better Business Bureau or that they're a chamber member. We're looking to do something like that where there's you know, an HFFI logo so that you can easily identify projects that have been impacted with El Paso County HFFI funds. And then in addition to that, it would provide us with the ability to provide more written materials. We do know that we're getting a lot of national traction, both from companies and nonprofits who are looking at mirroring our efforts, as well as the local media. And so I think having a professional appearance that has, you know, some very easily identifiable talking points and marketing materials would be beneficial for us, especially as I know, like I said, that we're starting to get a lot more attention at a national level for this program. Next slide, please. So staff is recommending that the court consider utilizing the $148,000 with a match going to UT Health to establish their HFFI coordinating center, which again, just to reiterate to the court, that would unlock the potential of 3 to 4 times that amount of funding over the next 2 years through the grant that they would be pursuing through the USDA. And then we would also ask that you consider allocating $10,000 to be used toward a branding and marketing effort. Now, keep in mind that we're not asking the court to necessarily take a vote on how to use these things. If the court does decide to utilize the remainder of the funds in any one of the options that we have indicated, that we will bring the appropriate contracts back to the court at a later date. Next slide. What questions do you have of us?
Commissioner Stout, do you want to add some comments to the presentation?
Do I have to? No, I'm just kidding. I appreciate, thank you, Dr. Wiggum and Ms. Gallegos for the presentation, and thank you to Andrea for putting it on the agenda. I think this is an amazing opportunity for us to do exactly what one of the goals of setting this money aside was in the very beginning, which was utilizing it to leverage other funding sources and bring in more impact to the program. And you know, I think that great job, by the way, for you know, in identifying this grant. I think that, you know, bringing in an additional $1 million towards this type of initiative in this community is going to be it's going to have great benefits, long-term benefits, especially when it comes to what we're trying to do here in El Paso County, and making sure people have access to healthy food so that their healthcare outcomes become more positive down the road. I hope we can seriously consider doing this. We have close to $150,000 left over, and we could possibly in the HFFI funding from last year, and we had talked about in budgeting for FY 2020 the possibility of tapping into further funding for HFFI if need be. And I think this is a great opportunity, and we should not let it pass us up. So I would definitely advocate for going along with what our economic development department has proposed and their recommendations, and moving this forward. You know, I think that we all greatly understand the need for access to healthy food and how that is going to have an impact on taxpayers going into the future. It's not going to be overnight, but this is a great way to keep this program going and to fortify and expand.
Yeah, I'd like to thank the four of you. It's just so impressive. I mean, you know, just to see the success of the programs and the success of the partnerships that have come together is very impressive. And, you know, one of the things that I feel the county should always be involved in is sort of triggering off, like in this case, where we stimulate something beyond what we do. So you're sort of presented the foundation. You guys are looking at opportunities from both public and private, you know, to be able to expand it. And I think the timing is just amazing. The timing for helping businesses, you know, focus them into some of these areas of healthy food, something that we want to create with tourism, and that is bringing in a lot of events and recreational events and athletic events. And you can't do that if you don't have the foundation of a culture in our community. You know, we sort of see Denver, Colorado, they're identified as people, you know, they do a lot of healthy things, they're involved in activities, but surrounding that are these kinds of programs and helping businesses develop the infrastructure for that kind of tourism that'll come into our community. So thank you for the presentation, great update. And I too believe that if we can, marketing is going to be very essential for us to do that. You know, I'm glad you included that as part of your recommendation. But I do think that any time that the county's money and the taxpayers' money generates or creates that domino effect to do other things, I think that's, I feel like that's a huge role of our county. This in particular does certain dimensions. One, we've always talked the county provides access, whether it's for food, for transportation, for healthcare. That's one of our big roles. And I think what you're providing is this access not only to people eating healthy, but to businesses being able to get into, like as we saw, the businesses that qualified or that were part of the award. Look at what happened to that business and how successful they've been. And also, what I like is this adaptation to being able to move and focus into what's happening right now. And COVID-19 is a huge challenge, and I think nothing should be more important than us being able to address COVID-19. So any adjustment or anything that we do going in that direction is always going to be very favorable. So as Commissioner Stout, I do recommend, I'm very accepting of those recommendations that you have for us. And I hope the same for the other commissioners. So any questions from the other commissioners that would sort of get a better understanding, and so we could go forward with their recommendation?
Judge, if I may.
Commissioner.
Again, I would just say very respectfully, you know, when these applications were awarded by the court, you know, I voted for the awarding of the applications, you know, a few weeks ago. So much has changed, and there's just so much uncertainty right now where the level of job loss and the level of food insecurity is just something that we have, again, never seen in our community. You know, I recognize, you know, there's certainly a value to helping, you know, these new small businesses in these new initiatives, but there are current businesses that have been in place for decades that are at risk of never coming back online. You know, you know, we've yet to receive, you know, a financial forecast, you know, on our side here at the county regarding the amount of losses that we're anticipating from both ad valorem property taxes and sales taxes. And I think, you know, and again, when we get to the consent agenda, you know, I mean, I think that anything, you know, that's non-essential, I know there's a contract that's on consent that we need to get back to. But I think things can, you know, at the very least should be put on hold until we get a better financial picture. I mean, we've all seen the lines, you know, out at the El Pasoans Fighting Hunger facility. You know, there's really more of a food shortage issue than I think than a healthy foods initiative, which was the intent of this, and to help certain businesses grow and promote healthy options, you know, and sustainable options for the community. But it's just, again, I can't emphasize just the level of economic devastation that we've never seen before in our nation's history since the Great Depression itself. So I think that needs to be prioritized. I think funds such as this, such as the Economic Development Fund, anything it is that we have to that should be set aside in a contingency until we get a financial forecast. The city had theirs today. They're anticipating approximately $30 million in revenue losses. You know, how are we as a county going to, if we're facing similar losses, how are we going to address that? And so before, you know, making additional expenditures such as these, such as the hot tax, the item that we had last time, regarding the awarding of the historic district, I mean, we really need to take, I think, a thorough examination of where we are financially before we proceed. If we're already asking, you know, if we're already looking into a hiring freeze as step one, and then potential furloughs, you know, as a future step, whether that be step 2 or step 3, or pay cuts, I mean, it's very difficult, I think, to justify, you know, these types of expenditures in this environment. Thank you.
Thank you, Commissioner Pettis.
I'd like to respond real quick. I think it's, you know, I definitely understand where Commissioner Pettis is coming from, but I also think that we need to be very wary and forward-looking as well. You know, this is money that creates money, and so I mean, I understand that you know, looking at financial forecasts, I think are very important, but I also you know, we need to really understand that by making an investment, there's going to be a return on the investment. You know, and when it comes to you know, the hot tax issue, from what I understand, that's a moot point, and I think we need to leave that out of further conversations, because hot tax cannot be used for anything other than what it's meant for, and the governor cannot make any changes to what is law and legislated, and so you know, I think it's important for us to be truthful about some of the things that we're proposing, and really make sure that we're making suggestions and making proposals that can actually be beneficial, and things that can actually be done. Hot tax can't be diverted to anything else, and the governor can't make any decisions unilaterally on whether that happens or not. It's the state legislature is the only body that could do that, and so save the fact that the state legislature came together in an emergency meeting, you know, we wouldn't be able to do anything with with the hot tax. So just wanted to make that point. And you know, there are definitely a lot of different issues that we need to be looking at when it comes to you know, the way we're spending our money and where areas we need to cut. But I definitely don't think that we need to cut out programs that bring additional funding into the community.
Judge, can you hear me?
Yes, we can.
Okay.
Yes, I'm sorry.
Thank
Commissioner
you.
Leon.
I tend to agree with Commissioner Perez. I think right now what was mentioned in their presentation does have almost like side effects on the COVID-19, and we may need those funds for more direct impacts. And yes, ultimately we can leverage those monies, but I think because of the situation we're in, I just don't think now's the time to move in that direction.
Completely understand. And I do just want to bring up, if I may, that part of the reason that we did bring this now, so I don't want the court to think that we're not cognizant of, what's going on. And just, I want the court to understand that part of the reason that we brought this up now is that the deadline for this particular grant application is going to be at the end of April. And because we do know that regardless of, what funding cycle we end up moving forward with, the partnership that we have with IHL for providing technical assistance to businesses in a very similar way to what a SBDC office or something of the like may do with normal businesses that are not necessarily focused on healthy food initiatives. That was part of the reason that we brought this to the court at this point. So I just want to bring up that deadline and to let you all know that this is certainly something that we are keeping in mind. So, but if the court wishes to go another direction, just let us know.
This type of investment, I think, is also going to be, very, very helpful when it comes to our economic recovery, and I feel like we can't be so short-sighted, and we need to look also into the future and understand that this community is going to have, recovery to go through as well, and there are many things like this that we can do that are going to that are surely going to help speed and quicken that recovery. Once we come out of this issue, once we come out of this problem.
And I agree. We had earmarked that money, so it's not like we're looking at additional money. And we had earmarked that you have 148,000, and what better way than to stimulate our economy? And you're absolutely right, Commissioner. Right now, one of the things I'm looking at is how do we come out? I mean, we're going to come out behind because we missed out on grants and opportunities, and we put things aside. We got a deadline right now that they have to meet, and we have the money available, and it's not completely for that, but it's also the marketing, which is going to be very good for us to market. I think the concept is amazing. We need to expand that concept and get other people on board. So I would hate to sort of hold on to 148,000 in this critical point of something that's already earmarked that can take us further out. And we had agreed this was a good decision, and not everything should be impacted by COVID or everything paralyzed by COVID, because one of the things we want to do is not be identified by that and say, what are the things that we can continue doing that are at our disposal at this point in time? So, those are my comments. I don't know, Commissioner Robinson, are you there that you could comment on the recommendation?
He's on the team.
Okay, so that sort of leaves the four of us. And well, Christina, what do we need at this point in time?
Well, right now there was some question that was asked before the Commissioners Court with some direction to give county staff. There wasn't you didn't have a final action to bring back a contract, would be my understanding. So it would have been any direction to give to the Economic Development Department in terms of what the court wants to do. It seems that we're in an impasse. There's a couple of you that have expressed not doing anything at this point, not moving forward. Others who've expressed, let us consider some of the options that were provided for. So there is no consensus at this point. So at this point, nothing would move forward unless we can get Commissioner Robinson back on, or bring it back next week to see if he could chime in at that point if you want to revisit it.
I just called him. Commissioner Robinson, are you there?
I'm back in now.
Okay, Commissioner Robinson, we're talking about the recommendations from Andrea Economic Development, and we sort of have an impasse at this point. We got two of us agreeing on the recommendations, and two sort of looking at postponing it and maybe looking further as to how we could utilize that money. So I don't know if you were how much a part of the recommendations. If you were not online, Andrea could go back and tell you about the recommendations they have.
No, well, I heard everything, but I couldn't comment. Something that keep getting bumped off. But I agree with the latter suggestion in regards to Commissioner Leon and Commissioner Pettis.
You'd like to wait on see something further use for the money? Is that?
Yes, sir.
Okay. Okay. Well, we've got an answer, Christina, and I don't know, Andrea. Maybe I would like to see maybe next week something that perhaps maybe each one of the commissioners would request. Some information or something that maybe suggest as well as what would be the more favorable use of that money. But just keep in mind on that, the timeline on that, on the application process.
Sure, absolutely.
So, go ahead.
Oh, no, I was just going to say, just reminding members of the court that when we do reopen grant applications, that does take a significant amount of technical assistance and staff time from the folks at the IHL, and that grant that they are currently operating under will be expiring in April. So I want to reiterate that. I would assume that they have probably spent collectively over 200 hours, and that's just off of this round of 6 applications. That's not even the time that was spent putting together the contracts and everything else. So I just want to reiterate that this could impact next year's ability to fully execute the grants the way that we were able to this year. So anyway, just pointing that out.
I feel like we're cutting off our nose to spite our face, and I just want to leave one last thought with y'all that austerity is not the same thing as fiscal responsibility, and I feel like if we're giving up the opportunity to bring $1 million to this community and more, we're giving that up, we're not being fiscally responsible.
Yeah, and I would love, just whatever, Andrea, you could do between now and next week to provide all the information, the impact, just something that we can all see. But I would really consider the other commissioners really looking at the outcome of 148 versus a couple of $1 million that would come into our community, and whether that's going to be at play, and look at it a little bit more careful. But of course, I'm not going to challenge anyone's decision on where they feel the direction should be. But Andrea, if you could sort of help out a little bit more of what's the impact, what's the outcome of not going forward, and maybe present it, and then have something on Monday, and then that would be at least one more opportunity to see if there's a change in our direction.
Sure, absolutely.
Judge, I think also next week we'll be giving a presentation on the economic outlook, which I think that combined with Andrea's presentation will be helpful.
Oh, it sure will, and that was Commissioner Pettis's request to sort of look at, what's out there and what's the impact that we're having overall. So I appreciate that combination as well.
And I think that Wally initially, when he initially presented to the court about and the economic downturn, presented that it could be as high as a $16 million reduction in revenue for the county.
Okay, thank you for the presentations. Thank you for your time and commitment to this program. I really appreciate all that information and all the hard work. Thank you.
Thank you.
Judge,
Thank you very
Commissioner,
much.
before we go on,
Thank you.
before Jessica reads the next item, I need to clarify which item was pulled from consent by Commissioner Robinson. I didn't understand whether it was 4B for the veterans funding or 4B for our paid claims.
4B. 4B.
It was B, Zimboy.
B, no, Victor.
B
Victor.
for the veterans
Oh,
funding.
Victor. Okay.
Okay, thank
Okay,
you.
great.
That's very
So
helpful because
so we're going
auditors
to come
was
back
waiting.
to that,
Thank you.
Jessica?
Yes, sir. No action will be taken for item number 9. Excuse me. Item number 10, Public Works, postpone March 30th, 2020. Approve and authorize the county judge to sign the construction contract between the county and JAR Concrete Inc. for HMAC overlay and fog seal services related to the county's 2020 roadway paving program. Funding is available in SR Road and Bridge Road Resurfacing, contract number 2020-0225.
Good afternoon, Judge, Commissioners. Norma Rivera Palacios with the Public Works Department. On March the 2nd, you authorized the award of this bid to JAR, and this is for the fiscal year overlay paving. Today, we're requesting the court's authorization for the judge to sign this contract. This contract has been shared with the vendor, and he's okay with the content of the contract. So Public Works is recommending approval of this item.
So moved.
Second.
I have a question real quick, Judge. Does signing this contract, does it obligate us to move forward with all of the projects that we may be looking at that you know, in the context of what's going on here, just, you know, talking about fiscal responsibility and austerity, and whether or not we need to be doing certain construction projects, is signing this contract going to force us to do anything in that manner, or?
So this is just for the overlay, but I did work with the legal team, and we do have an opportunity. We needed to cancel this to work with the vendor. That's why we gave the contract to the vendor for them to have the opportunity to review it and make sure they were comfortable with the content.
But Norma, at what point do we need to notify them if we don't want to continue the work?
We have 90 days to work with them. So they are prepared to start the overlay on May the 16th. Once they've prepared, all the roads have been prepared, they are prepared to start on May the 16th, and it would take 120 days for the project to be completed. Does this answer your question, Commissioner Stout?
Yeah, as long as there's, I mean, as long as there's some type of out if we decide that we don't need to go forward with some of those projects.
There is, Commissioner. We worked with our legal team to ensure that that was available.
Okay, thank you.
Good question. So there was a motion?
And a second. Commissioner Perez?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries. I'd like to go ahead and go back to the items that were pulled from consent. Item 4K was pulled by Commissioner Perez. Item 4K reads, approve and authorize the county judge to sign the professional services agreement between the County of El Paso and Public Sector Personnel Consultants, Inc. for classification and compensation studies in an amount not to exceed $50,000. Funds are available in General Fund, HR Contract Services General, Contract 2020-0304.
Commissioner Perez?
Thanks, Judge. Again, and just reviewing, you know, expenses that we're going to really have to evaluate until we get a better picture of of what the financial forecast is and really what this first impact was of COVID-19 for the month of April. We're going to get some important job numbers this month, but also we need our financial team to really look at the projections from, again, ad valorem taxes and sales tax revenue loss, and what steps is that going to lead from us? And I think this is a contract that perhaps can be put on hold for now until we get a better understanding of that financial picture.
So, Commissioner Perez, good afternoon. Melissa Carrillo with Human Resources. I completely understand in light of everything that's going on and your need and the desire to look at this contract a little more closely. One of the things that I wanted to shed light for the court on is this contract is something that was put in place based on a vacancy within my office who used to perform these classifications. As a result of that opportunity, we started working with purchasing for some time on creating this contract. And what the contract would do would finish out the reclassification plan for our JPD. So JPD is the department who was last on this reclassification plan. We've been working closely with Chief Martinez, and he understands that this study is coming. And so with the opportunity taken to use vacancy savings and outsource a portion of this work, the contract would allow us to engage in the analysis. However, anything that comes from the result of that analysis would need to be presented before our chief administrator for final approval. And so what I would ask the court to consider as possibly approving the contract as is, knowing that any ramifications or impacts that may come to any employees will be reviewed by Betsy, and those could be put on hold depending on our financial situation.
Well, again, I think it's important. Again, today the city received its financial forecast of the impacts of COVID-19, and we're looking at some reimbursement issues, from the county. I'm sure this could be revisited in a couple of weeks until, again, we get that financial forecast here on the county side. But it's just very difficult from a fiscal point of view to make decisions on these types of things that aren't sort of immediate in the immediate term. We really need to get that financial forecast to see how difficult our budget season is going to be and how much funding it is we're going to need to plan for, and what we're going to cut or amend. And so I would just feel much more comfortable that we get that forecast again on any type, before we vote on any type of discretionary type funding.
Melissa, we've used the word essential and non-essential, and I do feel that I wouldn't even want it postponed just for next week, but I think that we do need to get further into the implications that we have out there. Could you address the matter? Is it that essential that we couldn't wait for a couple of weeks and then get a better forecast of our community? Are there any reasons that the delay would create some kind of a difficulty for the county?
Thank you, Judge. So, when we look at this position, it's probably one of the most important contracts that I've been advocating for in my office. The team that put it together, Natalia Chaparro and Sam Trujillo, I'm very grateful for the work they did on this. In light of that vacancy, that work is still needing to be done. And those position requests and the staffing adjustment requests that come in, whether it's a request to downgrade a full-time to a part-time position, whether it's a conversion of this position to this position that results in savings, whether it's department restructures, which I have 2 currently underway right now. When we get those requests, someone has to analyze that work. And so absent that vacancy, that's been work that I have personally picked up because I wanted to maximize the process before outsourcing it. So the only hardship it will create for us is that the work will still need to be done regardless of the impacts that come from that analysis. And one of the big rules of thumb with staffing analysis mid-year is that if it is going to create a budget impact, we ask that you hold those requests until budget time. But you have several departments who, because of a retirement or a vacancy, they use those opportunities to really do some operational changes within their office. and those requests still need to be handled by someone. And so the hardship it presents is that someone has to do the analysis, whereas this contract is funded for within my line item. This contract does not require new funding from the county. It's already funded within a line item. I have presented my budget cuts to budget by the deadline last week. And there are certain services I was able to cut. This is one that's very important to my team in my office. But I completely understand the ramifications of what that analysis entails. I'd like to think that the work can still be conducted, especially for those positions that result in savings or that result in a budget neutrality. Again, I would really urge the court to consider approving the contract only because it offers the assistance to keep the work going business as usual, knowing that JPD, if that reclass does come back with any kind of impact, that's where we can, put a hold on it.
Is there, you're presenting a plan going forward on the freeze and all the things that are going to be part of the impact of COVID-19. Do you utilize anything having to do with what you're getting, this type of contract? Is it part of that understanding? Because you're looking at things that need to be held, freezes and all these other things. Is this part of, are we missing out by not having a complete understanding of classifications or anything that you're doing with this contract?
So those are really great questions. And I am meeting with Betsy this afternoon at 3 to really go over the first plan draft that I had submitted to her a little over a week ago. And that plan really talks about what happens during financial crisis, what types of preparation should organizations be looking at with regard to operational freezes, hiring freezes, potential furloughs, voluntary layoffs, and it leads in escalation to potential RIFs or a reduction in force, talks about benefits changes. So it has various RIF alternatives that the court can consider. But when you talk about reclassifications, reclassifications really are looking at people's jobs to make sure that what they're currently doing, that they're properly classified and compensated. So when you look at this contract, it's offering two pieces. The first piece is to finish off the reclassification plan with our juvenile probation department, which has about 200 jobs, 200 positions, I apologize. And when you look at the other side of the contract, it talks about maintaining classification as needed with the county. Currently, the county, I looked over the past 3 years, we average about 50 different requests from various departments. And so reclassification can impact your budget because we are regrading people. But the thing with reclassification is wanting to make sure that your employees are compensated appropriately. And that is where the impacts come in. And I completely understand based on the given situation where we're at with that. So that is something that if we need to amend the plan and address any kind of reclassifications need to be put on hold, completely understand that. The part of the contract that I'm advocating for is allowing the analysis to still be done so that the work continues. And it doesn't necessarily always mean that there's an impact. Sometimes the analysis actually results in identifying efficiencies or identifying red lines, or sometimes even, operations, the departments will realize, I don't need this, I need that. And so it doesn't always mean a financial impact, but in the positions or in the situations where it does, those are always subject to your chief administrator's approval before going forward. And so I can understand that piece during these times being put on hold.
No, and thank you, because we're going to go forward with a lot of different requests from HR, and I just want to make sure you have all the tools and everything that you need to make a full assessment without leaving a component outside, or maybe the opportunity to understand where some of the things need to change and which classifications are better, and or whether or not you hold back on certain things based on having the entire scope. I mean, you're almost there. That's what I'm seeing. Right. You're almost there, completing the entire analysis, and like you said, it did take a person that was doing that. So you're transferring that obligation and an HR responsibility sort of being outsourced as a way to save some money. So anyway, I think there should be some consideration to to following your recommendation.
There's your question.
Commissioner Robinson, I believe you were.
Yes.
Yes, sir. Go ahead.
This item was, as I understand, it was it's part of the budget.
Melissa?
Yes, sir.
I'm sorry, I didn't hear him. I'm sorry.
Is it part of the budget? Is this contract cost in the budget?
Yes, it is currently funded within a line item that I have in HR. This contract is not asking for any money at this time. It is funded, which is why I again ask for the support of the contract. Where impacts possibly do come, and I completely understand where Commissioner Bettis is coming from, is in the event analysis shows that certain positions need to be regraded, which results in an impact. That money does come also from another line item that is currently budgeted. Every year during budget hearings, Commissioner Robinson, the court sets aside up to $300,000 for reclassifications as needed. I can't give you the exact amount, but I want to say our balance currently teeters at about $280,000. And if Wally wants to correct me, but I know we have quite a bit of money still within our reclass budget because it was dedicated for JPD this year.
What I'm hearing, Judge and Commissioners, is, and not just on this item, on several items, the concern is our financial forecast. And the sooner we start reducing our financials, both on, as far as expenses goes, the more savings, the more we spread out the savings, and it's not as great of an impact all at one time. We are going to see significant revenue decreases, and we're going to have significant expense decreases as well, because unless the court had a different philosophy about our tax rate, but I don't think that at this time the court would do that. So that's what we're looking at, is every expense is an ongoing expense when it's a personnel cost. So the contract itself is not a personnel cost, but if the work came back and resulted in a reclassification of increases to employees, that is an ongoing expense. Another thing that maybe we wait, if you do want to wait just a couple weeks to approve this contract, we could also have a discussion about whether or not the increases would be funded through another revenue source, or whether they would be continuing to be paid by the reclassification funds. Also, whether or not it would be good practice for us to have a study showing that positions should be reclassified and increased, and then not implement it.
What impact the delay will cause? What impact?
If you all delay this a couple weeks, if you approve it, if you still want to approve it, it will just slow down the time for the work to start by a couple weeks. Correct, Melissa?
Correct. And the other thing that I want to say is, when we look at the reclassification piece, it is two parts, right? So you have JPD and then you have the other parts. It doesn't necessarily, like I said, mean that it will result in an impact. But if the contract is approved, Betsy's correct, it does not mean that we will jump on any reclassifications tomorrow, pending any kind of financial analysis and reporting that we need to give to the court.
Thank you. Betsy, where's your inclination on this? Looking at it from both the, commissioner's standpoint on waiting, and, where are you at?
So in general about finances, because I'm nervous about the impact to revenue on all these items related to expenses, I am more inclined to ask that we wait until we get a financial projection. I've been chatting with Ed Dion and with Wally. I expect that we will have that financial projection very quickly, but I would really like to see that financial projection and what we're going to have to cut on the expense side. As you know, we also have some significant expenses due to COVID-19 that will also be part of our overall financial impact. So I'm inclined to postpone on as many of these as we can while we get this financial projection.
Okay. So.
And Judge, if I may, I mean, it's also, I forget the exact number, but keep in mind that, I mean, the ultimate budget that was approved increased $36 million, but I think there was a $20 million gap between the amount, even with the tax increase compared to the expenditure. At that prior to there being this COVID.
You are starting to freeze, Commissioner.
That's the only thing that has me concerned, is that we need to just get
a couple of times between your Miguel.
Commissioner, I'm going to log you off and then bring you back on.
Okay, thank you. Commissioner?
Okay, Commissioner Pettis?
Yes.
Okay, please, you froze a couple of times during your discussion.
Where did I cut off? Or was it choppy?
It was choppy throughout.
Uh-huh.
Can you hear me okay?
Yes, it's perfect now.
The only comment I made was that, recall during the budget process, expenditures that were ultimately approved, and the gap between revenues and again, even with the additional revenues that were brought in, and so that's I hope that folks can provide us again in that process. Everything's going to kind of I think a department spends in normal times with attrition, folks retiring, not using, there's, like talked about every year. I mean, the amount has increased significantly, spending 90% of the budget, but I just don't know. Are we still going to be in the clear when it comes to
that's on his end.
Materialized yet?
Yeah, you were cutting out again, Commissioner. We might have to call you. You have that number that I sent you? Or try to reach out to him.
Thank you, Miguel.
Judge. I don't know how's the, but
it's still choppy. I'm trying to call you directly. If you can message me your phone, please. placing the call.
Hello?
Okay, we have you on.
This meeting is recorded and/or transcribed.
Okay, Commissioner?
Hello? Hello?
Yes, you are. You're on.
I think that's probably a sign I should just stop talking. And again, it was just reiterating, again, budgetary concerns. That the amount of the gap between expenditures and revenues that were ultimately approved in our budget.
Good afternoon, Judge, Commissioners. Wally Hargrove from the Office of Budget and Fiscal Policy. I'll just weigh in for just a moment, if I may. So, Commissioner, you're correct. When we did adopt the budget, we relied significantly upon reserves to balance that budget based off of current revenue estimates and our expenditures that were adopted. I'll be meeting with Mr. Dion during the early part of this week to prepare a fiscal overview for you. As Ms. Keller mentioned earlier, when we first started our COVID-19 updates, every month in our estimate, we believe we are going to have about an $8 million impact to sales taxes, fees, fines, etc. And I'm going to reassess that number. We'll have a full 4-week revenue impact in by the middle of this week. That'll allow us to zero in a little more closer on what we think that overall fiscal impact will be. But I've got to side with Ms. Keller, your county administrator. I think we do need to look at those things that are critical and urgent and probably pump the brakes on spending at this point in time. To defer for a couple of weeks is probably wise, fiscally speaking, until we really see what the full fiscal impact is going to be. And myself and Mr. Dion will have that overview for you next week.
Thank you, Wally. Appreciate the additional comments. So I think we're at that point. I think most of us would agree that a delay would be necessary. And then what I would recommend, Betsy, also that if there's items that fall into that situation that aren't essential, that can wait, that they're not brought up to us until maybe budget time, so that we don't have, we don't have to go through a process that we already identified. Sort of conceptually, we're saying that, we need to wait on a lot of these items until we have a better understanding of the budget impact and what the economy is going to look like and so forth. So that would be my recommendation, Betsy.
Yes, sir.
Okay, so it looks like we'll delay on this particular item on the consent agenda, but let's put it back into a regular agenda when you think it's appropriate.
So for right now, my recommendation, this is Christina Sanchez, Assistant County Attorney, just to delete the item. And when you're ready to do so, you can put it back on.
I agree. Thank you, Christina.
Is there a motion to delete?
Move to delete.
Second.
Commissioner Perez?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries. Now for item 4V, pulled by Commissioner Robinson, approve and authorize the county judge to accept the Texas Veterans Commission funds for Veterans Assistance Emergency Funds in the amount of $75,000 awarded to provide additional financial assistance to the Veterans Program for participating program veterans who are experiencing financial hardships due to COVID-19. There is no county match required. Contract number 2020-0316.
Actually, just to highlight this, Judge, I just asked you to highlight this action on this item in regards to, now, was this a max that we could apply for?
No, sir. I believe Carl Dwyer, our new veterans manager, Veteran Services Manager is on the line. Carl, are you on the line?
Yes, Betsy, I'm on the line. Can you hear me?
Yes, sir. Could you please explain how we came about getting this additional funding and what it's for?
Yes, I can. Well, good afternoon, commissioners and everyone. Carl Dwyer, the Veterans Program Manager. This request for additional funding came about on March 20th when the TVC approved the emergency funding request procedures for current grant holders to request additional funding for providing critical service to Texas veterans and their families throughout the COVID-19 state of emergency. The directions that were given by Mr. Bracken, the director of the TVC, that participate in our current organizations that currently have this grant could request up to 25% of their current grant authorized amount. Our current grant authorized amount that we have yearly here at the at El Paso County is $300,000. So 25% of that, the max of that, is $75,000. Myself and my staff sat down and we did some numbers and forecasting to take our best guesstimate as the financial or fiscal impact that COVID-19 was going to have on our veteran population. We played with some numbers between 25,000 to 50,000 to 75,000. We ultimately decided to err on the side of caution and go ahead and request the max 25% against our 300,000 grant that we could request, which is the $75K. Currently, as of time now, our current year grant is sitting around about $54,000 remaining balance. We are currently working with all of our community partners, reaching out to veterans. We currently have about 19 veteran applicants within our queue, within our system, which are going to be processed this week, which should take our balance somewhere around $30,000. We think that over the next 45 to 90 days, depending on how long this pandemic lasts, that the influx of veterans coming into our office for assistance is going to increase. So once again, to err on the side of caution, we went ahead and requested the $75K. We talked to our grant manager, Mr. Justin Grainer out of TVC, also about this request. And ultimately, we decided that it would be better to go ahead and request on the safe side to have the funds on hand, just preparing and leaning forward for the influx of veterans, spouses, dependents, and surviving spouses that could come forward experiencing financial hardship.
Well, I appreciate that explanation, and that's the reason why I asked the question as far as was this a max we could apply for, so that I understand how you came up with that figure. Because of the fact that, there is a great need and the need will increase. So I want to move to approve.
Second.
Commissioner Pettis?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson?
Aye.
Judge Samaniego?
Aye.
Motion carries. This completes all the items on today's agenda, Judge.
Thank you very much, and thank everybody. IT, great job. Couple of glitches, but I've been on so many, and by far, this was really well done. The IT and your Miguel and your team, thank you very much. Appreciate it. And thank commissioners. Have a great week, and everybody else that is in the broadcast. Thank you.
Thank you, Judge.
Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you.
This completes today's meeting at 2:41 p.m.